Sandra all the time is here with the cold hard truth. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, to call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra. And
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth telling, more problem solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. Good morning, good morning, good morning. Happy No. It's not Monday. It's Tuesday. I almost had you fooled, didn't I? I know it. Everybody's getting fooled by these holidays that we're having. But don't you just love this time of year where literally every single month there's a holiday? I mean, I think we're good until like September. And then we have a dry spell from about September to December. And boy, those months are extra hard. Ay. But what are we going to do? We can't have any more holidays. Like seriously, all employers are like, ugh, another holiday? Are you kidding me? So we get two this month because remember, Emancipation Day was added on last year. Now, I know a lot of you have some thoughts about Emancipation Day because a lot of you didn't even know what was happening. You're like, why do I not know anything about Emancipation Day? We'll talk about that a little bit. I think last year they came out with a big bang because it was the renewal. And then this year it was kind of soft, almost like a soft launch. Anyway, we'll get there. But of course, on Tuesdays, you know what Tuesdays is all about? It's kind of like a lunch and learn segment. Well, you don't have to be eating breakfast or lunch. Just have your tea or coffee ready because we go easy on you and we have a nice educational segment for our Medical Rundown Tuesdays with none other than Health City. And today we're going to be talking about World Asthma Day. This is very, very interesting. Obviously, there's millions of people all over the world that suffer from asthma, including right here in the Cayman Islands. So this is a good topic, definitely to learn more about. So let's go ahead and bring in Mr. Shamari Scott. He's no stranger to the program. Shamari, good morning. He's a Chief Business Officer at Health City, Cayman Islands. Good morning, sir.
Good morning, Sandy. How are you doing this morning?
We're doing fantastic. I see you got that nice computer of yours all sorted out.
All sorted out. Also, great IT team. So, Stephen, big shout out. Make sure that the drivers and the cameras were fixed and all good to go.
All that good stuff. Awesome. Awesome.
And then,
we gave
you a little break last Tuesday, seeing as you had other things you were occupied.
Oh my gosh, yes. Big day last week.
But we're back.
Yeah.
And as you said, it's World Asthma Day. It's actually the first Tuesday of May. So we are actually here in style for World Asthma Day. And as you mentioned, we have some guests that will be joining us shortly. And as you know, Mommy would say, you better introduce the people properly. So just letting you know that we have Dr. Archita as well as Dr. Harsha. Dr. Archita is the consultant pulmonologist, as well as she works in critical care and has sleep medicine under her belt as well. She has close to 2 decades of experience in her specialty, and she does the management of complex pulmonology cases, diagnostic and therapeutic pulmonology and pleural interventions, as well as sleep-related breathing disorders. And she's been on the program before, maybe not in a little while, but she's been here before, and so happy to have her joining us. Hello, Dr. Archita.
Good morning.
Good morning. Am I audible?
Yes, we can hear you.
Good
We can
morning,
hear you, yes.
everybody. That's great. I was a little worried about that.
No
Yes, so
problem.
nice to have you on the
Great to be
program
back.
again.
We
Thank you
can't see
so
you,
much.
but we can hear you.
Yes, loud and
Yes.
clear.
And we also have Dr. Harsha, who will be joining us. He has 15 years of experience, and a fun fact is that 6 years of experience teaching MBBS as well as postgraduate students. And his areas of expertise, just to mention that he's done over 1,000 bronchoscopy, diagnostic, and therapeutic procedures, over 100 medical thoracoscopies, as well as 300 USG CT guided procedures as well.
Wow.
So both are great professionals that will help us on this asthma day to go through everything we need to know about asthma, as well as how to gain help if needed.
Yes, good morning, Dr. Harsha.
Hi, good morning, Sandra. Good morning, Shamari. Hi.
And of course, we've shortened your name, Dr. Harsha, because you have a very long name. Do you mind pronouncing the full thing for me, just so that we can hear what it sounds like?
My full name is Shri Harsha Vardhana, is the full name.
Wow.
But with the initial, it will go much more Saukaya Venkataramana Swami. That will be like really long name.
Yes, I gotta tell you, it might be the longest proper name that I've ever seen, but we'll call you Dr. Harsha. That makes our life so much easier. So it's so nice to have you both on the program again. You've both been here talking about lung related and sort of respiratory issues. So it's nice to have you back. So today we're going to be talking about World Asthma Day. And of course, these days are an opportunity to educate ourselves and just sort of the general population about what these diseases, disorders, conditions are all about. So I think a lot of people have certainly heard of asthma, but it's celebrated every first Tuesday in the month of May. And there's a global movement by the Global Initiative for Asthma called GINA to raise awareness about asthma care and control. So I'm guessing that asthma has become much more manageable for the large majority of people, but occasionally we still hear of people having severe asthma attacks, and sometimes it's still even deadly. So this is why I guess proper care and control remains the focal point and remains so incredibly important, right, doctors?
Yeah, true. So we this is World Asthma Day. So every first week of May we celebrate it as Asthma Day.
Mm-hmm.
And this is brought by GINA, that is Global Initiative for Asthma, to increase awareness with the public and also among the physicians. So they set up new guidelines, and because it's a continuous learning process, so many research going on in the field of asthma as well, so about the diagnostics and evaluation and management. So all these aspects are updated every year, and it comes with a new theme, so every year. So this year's theme is to make inhalers available to maximum number of people. So that is the initiative this year.
Mm-hmm.
So as we know that inhalers are the mainstay in asthma. So, but still, though we have been saying this, still in the public mindset there is a stigma with the inhaler. They still
Mm-hmm.
think that if we take the inhaler, that is kind of addictive, or it would cause so many adverse effects and all those things. So that is why this becomes important to create more awareness with the inhale drug, and also to take out the stigma with the inhaler, to say that it is safer and it is meant for long term use and there is no harm in taking the inhaler. And
Mm-hmm.
moreover, it is the only way to take control of asthma. So
Mm-hmm.
we have to insist, educate people, and also the other thing is that still, I would say 90% of the population, particularly in underdeveloped and morning. So in underdeveloped and developing countries,
Uh-huh.
still it is not available for their use. So also we have to involve public engagement, public sectors to I mean to raise fund, to raise awareness, and yeah. So there are lot of things that we have to do about bringing these inhalers to common public. So yeah.
Mm.
So definitely we'll be looking forward to this.
Yes. So it's interesting that you say that there is still a stigma attached to inhaler use. I would have thought that, most people understood the importance of using their inhalers and, of course, using it properly, making sure that they have one to begin with. But I think this is a very, very important discussion. Just to remind our callers that the phone lines are open if they have a direct question for our guest or a comment, 936-2626, toll free for Flow customers, courtesy of Flow. So if you're a Flow customer, you will not be charged for the call. It shouldn't deduct any of your minutes. So do feel free to give us a call. So many people around the world, it says here, struggle to access the inhaled medications that they need. Now, apparently there's proper usage of an inhaler, which a lot of people don't always get correctly. Dr. Archita, how many of your patients would you say come to see you, they're asthmatic, and then you discover that, oh my gosh, you're actually not using that inhaler properly at all?
It's quite frequent, actually. You'd be
Yeah.
surprised. Even people who've had asthma for decades are, not always taught how to use the inhalers. They assume the way they are doing it is the right way.
Yes.
And to expand on what Harsha just mentioned, there's always an inhibition among patients. Maybe I'm using too much. Maybe I shouldn't be using my asthma inhaler so often. Maybe I'm doing myself more harm, or I'm getting hooked to it, and so they avoid it till they have an acute flare or exacerbation of symptoms, which is actually not something we want them to do. It's not just how they use the inhaler, but also when and which inhalers they should use. So, so I'm glad you asked these questions. Yes, appropriate use is obviously an issue. And I believe all physicians, whether it's a primary care practitioner or it's a specialist like ourselves, always spend time to understand patient usage, their patterns, their concerns about, their inhaler use, and also assess their technique. Usually I would spend a little time or even a video to explain how to use it. And it's okay if we are repetitive, but sometimes that repetitive explanation helps patient get the treatment better. And that's extremely important with asthma. And although you did not ask me this question, but I'm going to emphasize this, that it's very important, that we educate people that asthma control is the key to asthma management, not just dealing with flares, not just using a salbutamol or a rescue inhaler as needed, but taking control of the inflammation that's happening in the airways to prevent repeated or recurrent asthma attacks. That's extremely important.
Yes. Okay. And I see a few people in the comment section saying that they're asthmatic, and they're talking about the different things that they use. And so I didn't even know, for example, Irvlin's here. She says, I'm asthmatic and I use, is it Ventolin and Symbicort? So yeah, this is fantastic. Demara is joining us from New York. Good morning to all of our overseas listeners. Always nice to have you guys on here as well. So Mirstar also says that she uses the Ventolin only. All right, so we're going to get into all of these details this morning as part of the education surrounding World Asthma Day, which is celebrated today around the world. And again, the 2025 theme is make inhaled treatments accessible to all, or for all. So make sure that if you listen to the program and perhaps you're a parent that has a child that's asthmatic, this is a good segment for you to understand how these things work. So let's talk about what exactly asthma is. Just as I said that, Ms. K jumped in. She says, I believe that my child might be asthmatic. So we're going to get to her question in just a second. But let's learn, first of all, what asthma is.
To say asthma is a heterogeneous disease, first of all, because it has various phenotypes. So
Mhm.
it is not like there is one way of presentation. There are different modes of presentation. So it is a heterogeneous disease, first of all, and it is caused by airway inflammation. So there is an inflammation in the airway, usually because of exposure to allergens or change in weather or obnoxious gases or any kind of insult to the lung. So that will cause airway obstruction. So the definition is airway obstruction caused by inflammation due to any trigger, and it is heterogeneous. And moreover, it is when we do a PFT. PFT is a spirometric test where it's a simple test where they blow and we'll get to know the lung function. So in that we need to get obstruction, which is usually variable. So when we get a variable obstruction with this background, then we say that the person is asthma. This is by definition. Uh, but coming to symptom, they can have cough, they can have wheeze, they can have chest tightness, they can have short of breath. But usually it is triggered by any sort of change in climate or environment or exposure to dust, pollens, mites. So this is, I would say, as a definition. Moreover, we need to differentiate this from COPD, which is also an obstructive airway disease. COPD is chronic obstructive pulmonary disease, which is also a chronic lung disease, but it is a progressive disease and where the PFT is not variable. So this will differentiate asthma from COPD. But
Mm.
yeah, so but as I mentioned you before, it is a heterogeneous disease.
Mm-hmm.
So it doesn't present in a same way in all patients.
Mm.
True.
So when Miss K is asking about whether or not her child is asthmatic, how do you test? How do you know, so that she can know with certainty that the child is asthmatic?
So, depending on the age of the child, again, history is a very big key here. So, the observation of what brings on symptoms, what are the symptoms, what the child is presenting with is, of course, extremely important. If the history itself reveals, flares of symptoms during infections or during change of weather or on exposure to certain allergens, then it's
Mhm.
quite evident. Very young children are not capable of performing all kinds of lung function testing that or PFTs, as Dr. Harsha was mentioning. But a lot of times we'll go by the historical data provided by the parent, clinical examination, and we use certain surrogate tests to identify, children with asthma. And
Mhm.
if they are able to, and if they're able to perform tests, there's something called a peak expiratory flow that we can do even in clinic to find out if they, have an obstruction to their breathing patterns. We can provide such a device at home to see whenever they have symptoms, if their flow of air through the airways, when they do a forced breathing out, does it, is it varying or is it going down? And of course, if they're capable of doing a lab-based lung function testing, that would be ideal. So there's also a role for testing for other things like allergies or other triggers that we can identify and then avoid.
Mhm.
So pediatric asthma can be very tricky. And to this point, I know my colleague in Health City here was mentioning we should probably have a segment on pediatric asthma too. We couldn't do it for today's session, but at some point we should have our pediatricians come on board as well and talk to everybody, because it makes this is a common population. Children are one of the more
Mhm.
common people to present with asthma, and it's always tricky to make this diagnosis. There can be other things that mimic asthma. It's always better to get an opinion, both either from
Mhm.
the pediatrician or from a pulmonologist.
Wonderful. Thank you so much
Yeah,
for that.
and one more thing,
Mhm.
before we make a diagnosis of asthma in pediatric patient, we have to rule out other
Mm.
pediatric diseases. There are other pediatric diseases. Usually, they might have upper respiratory, in chronic respiratory infections and sinus and rhinitis and adenoids and There are many other like bronchitis. All those things have to be eliminated before we make. Sometimes they can even have congenital heart disease also, because all these present in a similar manner. So we have to exclude other diagnoses before we make a diagnosis of asthma.
Mm-hmm. Okay, fantastic, fantastic. Got Jean saying that she's also asthmatic and she used Ventolin and Seraflow. And I've had breathing issues since half of my right lung was removed when I was diagnosed with lung cancer in 2020, despite having never smoked a cigarette in my life. Wow. That's shocking. With proper management, the takeaway is that people with asthma can live, full and active lives. And of course, that's what we really want. Some of the risk factors for developing asthma include, Dr. Archita, you want to take this one for us?
Well, the risk factors could be a genetic predisposition. If you have multiple family members in your family who've had asthma, you're more likely or more prone to develop asthma. Doesn't necessarily mean you will have it, but you can have more, a genetic predisposition. And of course, environmental triggers. So if you have allergies, I'm sure we don't need to complicate this for people in general, but what Dr. Harsha mentioned about phenotypes is how people present. But there are also different mechanisms in which asthma inflammation takes place in the airway. They can be triggered or mediated by different inflammatory patterns in the airway, which then lead to asthma. So, that would be a more in-depth discussion and perhaps not for this forum. But, so depending on what is the trigger, the most common cause for asthma is an environmental allergen trigger, or it could be intrinsic triggers as well within the patient or the person himself or herself. But the environmental triggers or allergies are the most common form of asthma, or allergic asthma as we know it. And they can be either dust mites, they could be pollen, as we mentioned, grass pollen, pets at home, molds in the household or in your working environment. It could be a change in weather. It could be exposure to cold, or to extreme humidity in some patients, which is less common. And they could also be from environmental pollutants or smoke exposure. People who smoke are, of course, more prone to have worse asthma outcomes or worse asthma symptoms as compared to non-smokers. This includes people who are exposed to secondhand smoke.
Wow. So that's so interesting about how.
Yes, and not to forget, respiratory infections. So any moment you have, your asthma can be flared by having respiratory tract infections, which could be a common cold to a bad asthmatic bronchitis where you have airway inflammation, and this can trigger asthma symptoms as well.
Very, very interesting. Thank you so much. Evelyn says that her truck is diesel and she has to sit inside of it before she starts it. If she walks behind it after it's switched on, that's a trigger for her. She also says that the smell of cigarettes also bother her. And Mirstar says, yes, cigarette smoke triggers her asthma and allergies and makes her really sick. So I know, I'm not asthmatic, but cigarette smoke also, any form of cigarette, cigar, or anything else, really does not make me feel well either. So good morning to Miss Alba. Soka says that her son has had an asthma attack when he was 5 years old. He continued to have attacks for the next 5 years, often ending up in the hospital. When I went into hospital to see him, 2 young nurses came up to me to say his doctor was over-medicating him. And when they mentioned it, he told them to do as he said. And she says, oh, yeah, an Indian doctor came to me and told me to take my son home. And anytime he felt he was having an asthma attack, to drink hot tea, as it was the steam, like the nebulizer, that worked. And then 23 years later, unfortunately, he got cut off. So, obviously, this was quite some time ago, but I'm assuming that asthma treatments have probably changed in the last 23, 25 years. And is it common now? You say that this is one of the reasons why people don't use inhalers as appropriately as they should be, according to instructions, is because people are telling them, oh, you're over inhaling, you're overusing it. So talk a little bit about, when it comes to treatment, how people are potentially utilizing their inhalers?
So,
I think when
go
we
ahead.
make a diagnosis, so if we are not educating the patient or particularly in pediatric population, if you are not educating the parent well, this is how they get an image that either the patient is not treated well or they are over treated. So especially, I mean, classically even they diagnose asthma without PFT, but sometimes we may have to make a
Mhm.
diagnosis of asthma without PFT in pediatric population, particularly when they are not able to do a PFT. But moreover, we main problem here is they they tend to not follow up. So here in when we're treating asthma, step up and step down, these are the two essential things. That means when the patient has come to you with an exacerbation, so when the patient has come to you with an asthma attack, when the patient has come
Mhm.
to you in the triage or with acute symptoms, so we have to put them on inhalers or even IV steroids or oral steroids depending on the severity of the symptom. But
Mhm.
as and when the symptom get better and subside, so we need to step down the treatment. So we have to carefully observe the patient and then we have to cut down medication gradually. Usually this doesn't happen. So they come to the hospital, they take the inhaler and they continue to take the same inhaler. And one
Mhm.
day they know that they have developed some adverse effects. That is when they think that, okay, all this happened because of the inhaler and I don't want to take the inhaler. It can be on both the sides. It can be from the
Mhm.
doctor's side and from the patient side. But we have to understand that when we're treating asthma, so step up and step down are the two essential things. That is one thing. And the second thing is that, particularly otherwise, also in an asthma patient, so steroid are the mainstay of inhalers. So earlier I was seeing these messages. They were saying that we use Ventolin, we use Seretide. Seretide is a combination of a bronchodilator and a steroid, inhaled steroid.
Mhm.
But usually in asthma, so when we diagnose asthma, so mainstay of inhalation is steroid along
Mhm.
with the bronchodilator. So patient again they have a stigma. I should say that they think that having this inhaled steroid that will cause other adverse effects and everything. So they have to be educated about what they're using, and it has to be changed or stepped up and stepped down appropriately. Then I think they will have the confidence.
Mhm.
But definitely we have to use they have to use inhalers are the mainstay. That's what we are here today. So to educate them, inhalers are the mainstay and we have to stick to our inhaled medications.
Mhm. Okay, very good. Dr. Archie, anything you wanted to add in terms of, oh, I think
Yeah,
somehow we lost
some
her. Okay.
network issues, I think.
Yes, no worries. All right, Dr. Archie, there you are.
Please
I'm
continue.
sorry, I accidentally did something to log myself off.
That's
That was
okay.
not intentional.
Yeah, ma'am, if you
Sorry.
want to add something, so
No,
Yeah.
I think you've covered it all. But Sandy, this brings us to the point why we are celebrating this or observing this World Asthma Day. It is to, there are a lot of misconceptions and misperceptions about asthma. And of course, in the community, but also among healthcare providers. And that's
Mhm.
exactly what we need to address. And that's why, observations like these help us come across to both our colleagues in healthcare and, of course, to the people in general or patients in general, where we want them to be aware of what is the right therapy, what is the optimum therapy, of course, what is overdoing and what is not, so
Mhm.
that there's no misconception about asthma treatment. To address the individual's question that they asked about tea, yes, home remedies are never harmful if you give them in the right manner. Tea does contain theobromine, and that helps bronchodilation, but that cannot replace treatment for an acute asthma flare. You'll be surprised by, even in this time and era, when there are effective and controlled medications available, which can allow asthmatics to have a very normal, very productive life without having absenteeism from school for children or from work for adults, or having to visit hospitals often or emergency rooms often. Even now, we have, unfortunately, a lot of asthma-related deaths happening, which is unfortunate, right? We can't control a disease, but it's a lot of times the misperception or misconceptions that we have, which are a barrier to appropriate treatment. And as Harsha mentioned, inhaled steroids are the mainstay of a maintenance therapy for somebody who has persistent asthma. And these days, the concept has changed. There's more and more guideline data and otherwise data available to indicate that even a rescue inhaler, you'd hear a lot of asthmatics who say, oh, I don't have symptoms all the time. It's only in this situation that I have a symptom, or in that situation that I have a symptom. And why should I be taking an inhaler all the time? So the concept is that we need to assess asthma. We need to assess whether it's just an intermittent asthma, which is brought on by certain exposures, or a seasonal asthma, or whether it is a persistent asthma. If it is a persistent asthma, then maintenance therapy as well as rescue therapy is the dictum that we should go with, right? And the maintenance therapy should contain some form of inhaled steroid if that is required. And if it's a rescue, even though it's a rescue, the paradigm has changed. We used to use only Ventolin or salbutamol. I do not want to use brands. Ventolin is a popular brand name for salbutamol, which is a bronchodilator. It acts very quickly, but it does not take care of the problem at heart. It doesn't take care of the inflammation inside the airways. And so it's a short acting. It acts for a quick burst of relief. People find that, it's more effective than any other asthma inhaler because it gives us a very quick relief. It could be salbutamol, it could be albuterol. These are quick acting inhalers. But they're also short acting, and they do not take care of inflammation within the airways. So this concept has to be cleared. That yes, if you're using an inhaled steroid, why you are using that is to reduce inflammation, to treat the cause, not the effect of the problem. And so that education is extremely important. Like I said, there's a shift in paradigm. We now believe that we should use steroid-based bronchodilator, steroid plus bronchodilator combinations even for rescue, because that has shown better outcomes. There's data to indicate that only using salbutamol to control both your asthma as a maintenance and rescue can have increased risk of mortality, from asthma-related exacerbations in people who keep taking their salbutamol or rescue inhaler 2-3 times a day, every day, even when they're having a flare, sometimes more than that, and they think, that's their only form of treatment. That's inappropriate. And that's something they need to address with either their primary practitioner, or if they have persistent symptoms, to see a specialist. That's extremely important.
All right. Very good. Someone mentioned in the comment section about carpet, taking the carpet out. I don't know that most people probably have a lot of carpet around anymore, but possibly said that triggered their son's asthma, along with strong scents, such as strong perfumes and those so-called air fresheners, Lysol, etc. So any sort of irritant that could be in the air, obviously, is a potential irritating, element. But things like carpet, not changing, vents, the air conditioning, what do we call them? Filters and so forth. I'm sure those things matter as well, just in terms of good air quality, right?
Very true. So depending again on the triggers, it's extremely important that the first dictum of asthma management in anybody who has asthma is prevention, right? We always say prevention is better than cure. And that's why we're talking about preventive inhalers, as I was talking to you about. But prevention begins at avoiding the allergen that triggers asthma. So that is extremely important. And a lot of asthmatics will tell you what their triggers are. So it's always best for them to try and modify their environment to eliminate these triggers. So if it is dust mites and there's the carpeting which hasn't been cleaned for a long time, obviously it is gathering some dust mites, isn't it? Or if you don't change your air conditioning pre-filters often, it's obviously gathering dust or lint. If your workplace is such that you have a lot of exposure to dust and you don't use any protective mechanisms, it's going to trigger your asthma. So it's very important to identify the trigger and avoid it. If you cannot identify a trigger, it helps to do certain testing, like allergy testing, that would also help us identify a little more definitively, and then we can avoid those triggers. So That's something we need to keep in
Yeah.
mind.
Okay, very good. And although a lot of homes no longer have like full wall to wall carpet, there's a lot of throw rugs and stuff. So you should be careful with those and making sure that they're cleaned on a
Clean.
regular basis.
True.
Yeah, usually these things, the curtains, the carpets, rugs,
Mm-hmm.
they have to be sun dry. Usually, that's what prefer sun
Mm-hmm.
dried, and it has to be. I mean, the house has to be well ventilated, so that is very important because
Mm-hmm.
the dust mites are present, and over the time it can grow fungus. And
Mm-hmm.
so these two are very common and important causes or triggers
Mm-hmm.
for asthma, because most of the time the patient says, I mean, when I am in the office I am fine, when I go back home I get these symptoms. And
Or
some,
vice versa.
like, they say that I'm here I'm fine, at Cayman I'm fine, but when I go back home then the symptoms start. So they should understand that the trigger is in their home. So they need to definitely change everything what they have and keep it well. Here particularly, the houses are like it's closed, right? And because of the central AC, so we have to make sure that all these ACs are serviced appropriately and they are well maintained and cleaned, because they can be the source of their asthma. So that is extremely important.
Mm-hmm. Mm-hmm. Hmm. Very good. So pay attention, folks, to what is potentially triggering it for you. So, is there such a thing as seasonal asthma, or is just that sometimes it's triggered by different things?
True, there is something called seasonal asthma, more common where there are a lot of seasons. In Cayman, I think we are blessed with, a very pleasant season all the time. But every time there is some amount of, say, spring or summer, and there are a lot of tree pollen or, grass pollen or plants blooming and budding, some people will have, if that is their allergic trigger, they will have asthma flares around that time. Or come winter, when the weather suddenly gets cooler, they can have trigger of asthma symptoms. In Cayman, it's very relevant when you have the Saharan dust coming in. A lot of asthmatics will report flares. Or when it's flu season during the cold and there's an influx of a lot of people coming in with flu-like illness, tourists coming in, or school children getting it, they will have a flare of asthma symptoms. So yes, there
Mm-hmm.
are seasonal patterns. Traditionally, seasonal asthma is because of seasonal environmental triggers or pollens and other things like that. But yes, we do see seasonal patterns even here in Cayman, where we don't have too much of variation in the weather or the temperature.
Mm-hmm. Hmm. Very interesting. 936 phone lines are open, toll free, courtesy of Flow. So do feel free to jump on if you have a question or comment that you would like to make. So good morning to Miss Nancy. We've got Johan joining us. Johan, we're talking about asthma and asthma management on World Asthma Day. So, if you suffer from that or any of your loved ones, or if you just want to know some general information, this is a fantastic show. My Zach filters get changed every 3 months, says Irvlin. Good morning to Miss Charlene. Charlie says, my daughter has had asthma since around 7 years old, and she can't be agitated in any way. Anxiety is a no-no, has to keep calm. So even like emotional agitation can bring on an asthma attack?
That's true.
Yeah.
Oh.
It's true.
So, like we can, as I told you, there are several phenotypes. There is
Mm-hmm.
something called as exercise-induced asthma. So, exercise-induced
Mm-hmm.
asthma means when someone is exerted, so
Mm-hmm.
then that trigger asthma. So usually that we can see in athletes or someone who is doing a regular exercise, we can see them, they can come up with this. So in a similar way, when we get anxiety, similar mediators are released in the blood, which can also lead to airway obstruction or bronchospasm. That
Mm-hmm.
So that's why definitely when someone gets anxious, so the asthma symptom also can definitely trigger. So we have to treat anxiety in that case. So
Mm-hmm.
someone having a reflux disease, so when the reflux increases, when it can also trigger asthma symptoms. So there are so many other things which can also trigger asthma, definitely.
That's true. So, like I had also mentioned that this is either extrinsic or intrinsic. So the triggers can be outside, which is the more common form, that you have an allergy and then triggers your asthma. But there are also intrinsic triggers, and anxiety, agitation, extreme. Some people with when they're having a big bout of laughter, they'll notice that asthma gets flared, or extremes of emotion, exercise, acid reflux. These are all risk factors for developing asthma. Also, there are multiple other presentations of asthma where some people who have sinus affliction, very commonly they have allergies which affect their sinuses, or nasal polyps will also have, there's a subset of asthmatics who will have both chronic rhinosinusitis or chronic sinus infection, or rather inflammation associated with asthma. So different people may have different presentations, and each time their upper airway or the sinus passage gets inflamed, they can have a trigger of asthma. So it could be, in a lot of ways, it can present in a lot of ways.
Okay, fantastic. All right, folks. So again, World Asthma Day. Of course, Johan is in the comments talking to Shamari this morning, asking Dr. Shamari, maybe he can help me with the sickness I get from your dry up brownies. No, that's called being a diabetic. That's a whole other show.
As much as he talks, I'm sure he doesn't have asthma, because
right.
Shamar, with what's about these brownies? I'm curious.
I have not tasted the brownies, so I can't comment.
Really?
But
oh my goodness, we've got to make sure we solve that. But he's definitely obsessed with barriers to inhaler access, so cost and availability. Is this something that in Cayman, I know that obviously World Asthma Day is worldwide, so wealthier countries, high cost is still a problem. We've seen even in the United States of America, for example, that there are people who died from simple things like an asthma attack because they couldn't afford the inhalers. What's the average cost of an inhaler in Cayman, and do most insurance companies cover this if you have, even the SHIC program?
No, the cost of the inhalers, I mean, I cannot specifically
It's not constant, yes. It may vary for the type of inhaler.
There are different varieties of inhalers with different combinations, and because it has been updated every year, so we come up with new molecules and new generation of drugs. So obviously when someone is prescribed with a new generation of inhalers, they are definitely costlier when compared to the conventional ones, but it is all covered with the insurance, so that should not be a worry. But definitely even in the island we do not have the availability of all the inhalers because of the logistic issues. But still it is, I mean, we can very well treat with the available inhalers in the island.
So we have almost everything available, with, yes, of course, a few exceptions, or certain molecules which are not available. And most insurance providers cover the cost of these medications. There may be a small amount of copay, which may be a concern for some people. It's for the uninsured or underinsured. Unfortunately, we still have a subset of such individuals. It should not, the cost, can vary with the type of inhaler, like Harsha mentioned about the generation of the inhaler. And if they have concerns about cost, I think it's a good idea to discuss it with your provider, with your healthcare provider, with your pulmonologist, or with your primary care doctor, saying, this is an issue for me. What can I do to make it more affordable? And I'm quite certain that, they may be able to afford at least, some form of asthma control medication. And we can work with them, or consciously look into it. Like Harsha mentioned, we can't know the cost of all inhalers, all the brands available, but we can consciously work with them to try and make it more affordable for their care. Inhalers more affordable. But definitely that should not keep them away from taking maintenance or preventive therapy, which would help their asthma control. What I want people to understand is avoiding taking a maintenance or preventive therapy lands up people in emergency rooms or admitted in hospitals with asthma flare, not just affecting their overall health or outcomes, but also increasing the financial burden, isn't it? So if you end up requiring frequent hospital visits or frequent doctor's visits, to get nebulized, or to get steroids, or to get sometimes they're also because of an infection, because they're more prone to then when they're having underlying uncontrolled asthma, they end up getting more and more medications, which again increase the overall cost of healthcare. So we need to understand that if we can get something more preventive, which we can try and work with them to make it more affordable, that would definitely in the long run be a better option than worrying about the cost of a preventive or maintenance inhaler.
Mm-hmm.
Yeah, I mean, this is something the insurance providers have to think about, because they have to understand that if they can sponsor the inhalers, that is saving their, expenditure, because we spend more, like 10 times more when they're admitted rather than when they're taking inhaler. So that is preventing admission. So this is something which the insurance provider has to think about. And yeah.
Mm-hmm.
So, well, again, it's not a concern with most insurance providers, but yes,
Yeah,
if
they
somebody
use,
has an underinsurance, yes, that can be an issue. But
yeah.
again, the larger benefit, or even for that matter, in making decisions about insurance plans, should be to allow preventive treatments, right? So that is obviously a better way of managing an individual as well as a group of insured people, because if they are going to have frequent flares, they're going to end up having overutilization.
Yep. All right. So Irvlyn has a question. She wants to know, why do they make the asthma pump? Why don't they make it available over the counter for purchase instead of a prescription drug? Because it is a prescription drug, right?
Yes, it is a prescription drug. Both overuse, underuse, inappropriate use, or misuse can be a potential problem. And so they are not to be, in fact, I discourage a lot of people here can get salbutamol over the counter. It's fine in case of an emergency situation where a pharmacist can issue that particular medication, but it should not be an over-the-counter medication, because then people would either overuse only their rescue and not end up preventing or controlling their asthma, which I just mentioned. There's been lots of paper and a lot of data which has come in which says rescue inhaler use alone, both for treating or managing chronic asthma, has led to increased all-cause mortality from asthma. And we do not want people dying because of asthma, because they just didn't, they could get something over the counter to fix their problem quickly, like a Band-Aid, but did not deal with the problem. Yeah. So these are prescription-only medications, and they should stay that way. I am a very strong advocate of that.
Yeah, that is true, because it is not like one inhaler will take care of everything, right? So
exactly.
There are different medications, though they look similar, but the medications are different. And there are different varieties of inhalers. There are like dry pulse inhalers, breath actuated inhalers, meter dose inhalers. So everything is optimized and then it's given to the patient. It's not like we are giving one drug to everyone, right? So that definitely cannot be kept over the counter. That would be causing more harm than
good.
Yeah. Okay. All right. Good question. Cayman 49er says, good morning. I'm joining a bit late. Question, is there an age range for people to get asthma? So, if you've reached 21 and you've never had asthma, does that mean that you're never going to get it?
No, that's not true. And it's a good question. Asthma is more common to start at a younger age. Usually childhood onset asthma is a more common type of asthma presentation. However, it's well known that adults can also develop asthma. There's something we know as adult onset asthma. Sometimes the mechanisms of inflammation can be different from that of a childhood onset asthma, but that's for us to look into. But definitely you can have asthma as an adult too. In fact, getting more and more common these days. I have seen even, there are of course outliers, they're not common, but you can have, I've seen patients developing adult onset asthma even in their 7th or 8th decade of life, which is very, very unusual. And usually these are secondary asthmas. They're associated with some other comorbid condition, which has made them more prone to developing asthma. But adult onset asthma is very well known.
Wow. Yeah. Thank you. Good question. Right. So Soka says that an inhaler in the US is about $60. Wow. And how long does an inhaler normally last, like the typical patient? Depends, obviously, I know, on how many.
Exactly. Depends on the dosage.
A month, usually. Usually a month. It will have 120 doses, usually, generally. So
Okay.
if they're using two puff, I mean, if they're using two puff in the morning and two puff in the evening, so it
Mhm.
will come for a month at least. That's how
Mhm.
they usually, yeah.
Yeah, most of the preventive inhalers are dosed like that. However, it cannot be generalized.
Yeah,
It's like asking a one fix for a very variable disease condition. So we cannot comment on which inhaler lasts for how long. It depends on which inhaler you've been provided. And usually, most of these inhalers come with a dose counter. So you know how many doses are on it, or the box mentions how many doses. And there will be renewals on the prescription depending on how often you need to refill it. So,
Right.
please follow instructions. Do not go by a generalization. Oh, this inhaler the doctor said it should last me so long, so it
Mhm.
lasts me that long. Please read about it. And whenever we prescribe these medications, obviously we will
Mhm.
let you know that this is the frequency of refilling your prescription. And. So,
Right.
but in general, one rule does not apply to all.
And as physicians, how important is it, especially with children, but even adults, to ensure that they're properly using their inhalers and that they have had good instruction on how to use it? Because occasionally I've gotten an inhaler, like, when you get really bad cold or flu, they'll give it to, I guess, open up your bronchial area, whatever, right? And
Mhm.
so I remember one physician was saying, this is the proper use. And I thought to myself, wow, I've had it a couple times before and no one really told me how to use it. They just prescribed it and assumed that I knew. And apparently there's like a technique to make sure that you are, breathing a right way and taking in, I guess, the proper dosage. So how many people you think are probably out there don't even know that and misusing their inhalers?
yeah, I
Quite
think,
a few.
yeah.
Ungeneralize, but quite a
Yeah.
few. Yes, it's very important, and it doesn't mean sometimes as physicians we tend to feel that somebody's asthmatic since a child. We assume that they know to use their inhaler, but that's not necessarily true. So every first visit, in fact, that we have with the patient, I mean, I can say this at least for myself, and I'm sure for Harsha as well, we will spend some time in educating them about appropriate asthma inhaler use, even
Mhm.
if it's an extra time out of our schedule, because it's extremely important. It's the same different, I mean, same situation as having a car and knowing how to ride it, right? So
Mhm.
you can own a car, but you don't know how to drive it. No point in
Yeah,
having the car.
I
So
know.
it's the
We got a
same
lot
thing
of
with
them.
the inhaler. So if you have an inhaler, that's great. You know when to use it, for what purposes you have to use it is great. But if you don't know to use it appropriately, it's probably not doing you good enough. So it's extremely important to know the technique.
Mhm.
And please ask your primary care practitioners, ask your specialist doctors, ask the pulmonologist, ask the pharmacist if you're not sure. Read the package insert that comes with it. You can watch videos online that help you learn the appropriate technique. And sometimes there can be more variations to a technique, but it's extremely important that you get the technique right.
Yeah.
And for all my colleagues out there, if they're listening, it's important that we spend some time, make sure the patient is taking the inhaler appropriately.
Mhm.
Yeah.
Dr. Lupoy says everyone should be using a spacer with their inhalers. So what's a spacer?
Not everyone need to use a spacer.
Mhm.
So a spacer is like a reservoir which is attached to the inhaler. So
Oh.
what happens is, so especially when we are using a meter dose inhaler, so there has to be hand mouth coordination when they're using
Mhm.
the inhaler. That means, as you also mentioned, so there's a proper technique and way of using an inhaler.
Mhm.
But sometime what happens, particularly in pediatric age group and
Mhm.
elderly patients, so it is not possible for them in spite of having enough education. So they may not be able to do it appropriately. So that is when we tell them to use a spacer. It's like a reservoir where you attach the spacer to the inhaler, and so you can, whatever the dose you need, you can puff it to the reservoir, the spacer, so that you can take a normal breath rather than I mean, you need not coordinate with the inhaler, the pump, but you can take a normal breath. So that will
Mhm.
help to I mean, that will avoid the wastage of drug first, and that and adequate appropriate dose. We just make sure that appropriate dose is gone inside. So that's why
True.
we tell them to use spacer. Yeah.
Yes.
Mhm.
So I agree partially with Dr. Lukloy's statement, and I appreciate his inputs because he sees a lot of patients, and obviously, it's always better to provide a spacer when you're in doubt about patient's technique. And we encourage that too. It allows, like Harsha mentioned, allows appropriate dose delivery, and takes away the risk of patient not coordinating well. But we need to understand that there are multiple types of inhaled therapies available, including aerosol based, or what we know as metered dose inhalers. There are dry powder inhalers, there are mist inhalers. There are multiple techniques, multiple drugs are available at different formulations. It's extremely important to understand what formulation we are giving and what formulation is appropriate for our patient. The same drug can be available in multiple formulations. So that's extremely important, and that's why the doctor's role, and not over the counter prescriptions. And of course, we need to assess patient's technique. So as Harsha mentioned, in both extremes of age, it's always better to use a spacer, which is a reservoir, to hold the drug. So if there's a lag between when you press the dose and you inhale inside, actually you don't waste the medication, and that really improves drug delivery by at least 10 to 20%. So I agree with Dr. Lukla on that part, but not everybody will need it. So there are people who can coordinate really well. They find the spacer difficult to work with. So asthma therapy has to be personalized. One size does not fit all, just like most of the medications or in medicine. So we have to make sure we are giving the patient the right device, the right drug in the right formulation, and assessing their appropriate use of it. That's where we are. Mhm.
Yeah, there is something called as uncontrolled asthma. So when we, because the patient comes and says that, okay, I'm using the inhaler, but I'm not getting any relief. So generally there is a tendency that, so we just step up with the doses and add up more drug. So before doing this, so we have to make sure that patient is using the inhaler and he's using the inhaler appropriately with the right technique. So every time you see the patient, every visit, make sure that, so usually, I mean, we tell the patient to bring the inhaler with them so that we can see and know what they are doing. So that is extremely important. If we are not doing that, then patient definitely will have a poor compliance, and that is when we say that patient will end up having an uncontrolled asthma. Yeah.
Yes. All right. So again, happy World Asthma Day, folks. Public awareness being critical, and this is part of the public awareness campaign, empowering patients to manage their condition. Equity and human rights, so access to essential asthma treatments should be something that all governments should be pushing for, in healthcare providers, because everyone deserves a right to breathe freely, and a call to action for governments, healthcare providers, NGOs, and pharmaceutical companies to work together to eliminate some of the barriers that exist, or all of the barriers really, which include making it more affordable, making treatments more available and appropriate for all. So these are some of the things that certainly, are the goals for asthma awareness. Cost and availability, making it definitely more affordable there. So Joseph says, can a person become asthma free over time? Now, we have heard of this. People say, oh, they grew out of it. Is that right?
There is a terminology called asthma remission, which is definitely possible. So we cannot say that it is not possible. So it is definitely possible. But no one will agree that it is, I mean, cured or anything. I'm for sure Dr. Archita will also agree.
Yes. So people can go into remission and stay in remission for a long time, especially if they're, the triggers that were triggering them are taken care of. So it's not uncommon that you'll say, "Oh, I've got rid of asthma." But can we guarantee that it will never come back again, is what I think Harsha and I are both hinting at. We should never assume that this tendency to having airway inflammation or hyper responsiveness in the airways is gone away completely. And always carry a rescue, or always have a plan of action. There's something called an asthma control plan, which we also tend to give to most of our chronic asthmatics, so that they need to know what to do in case the symptoms recur or flare up. It's fine, well and fine, if your asthma is well controlled and you are not needing a lot of medication. That's great. We can always step down, but you should always have an asthma action plan. You should know what to do when you have an acute exacerbation, and not say, "Oh, I got rid of my asthma. This can't be asthma," right? So it's always important to know that.
Right.
Yeah, I mean, there are, other treatment modalities also, like giving anti-Ig and
Yeah,
interleukin.
I was going to come to that. Thank you for
So
bringing
that
that
is
up.
monoclonal antibodies. So which are meant to, which I was mentioning as remission. That means like as if you're having no asthma for years. So
Mhm.
that's what these drugs are for. But we need to assess and evaluate and see that if they are fitting into that category before we give them these treatment options. So there are treatment options where you can be free of inhalers also. So
Mhm.
that depends on the
So again, yeah, that brings us to a more complex topic. I think if you want to have touch on it, actually, Harsha. So people who have severe persistent asthma and who have, we can understand what is the type of inflammation they're having in the airway, as I was mentioning earlier, and Harsha
Mhm.
mentioned the phenotype, but there's also the genotype of how, what kind of inflammatory patterns we are seeing inside, the airways based on surrogate testing, breathing testing, blood tests, allergy tests. We can target these, a big subset of severe persistent asthma individuals with certain biological or targeted therapies, where we can try and reduce that type of inflammation within their body by medications or injections that help control asthma significantly better. And we've had grand outcomes in some of our patients where they're in complete asthma remission or in good amount of asthma remission, and we are able to even come down on their inhaler therapy or sometimes even come off inhaler therapy, not always, but sometimes. And so that is extremely important to identify these individuals. And there is a very serious role for specialist assessment at that time, for such medications. It needs to be a carefully selected drug in a carefully selected subset of individuals.
Mhm.
And of course, these therapies are extremely expensive, so they should be done where the benefit is, of course, significantly more than the potential cost of treatment, where we are seeing somebody getting recurrent flares because of an uncontrolled airway inflammation, and we know the mechanism behind it. It's a good idea to offer these treatments or biological
Mhm.
treatments.
All right, fantastic. Very good discussion today. Thank you guys so much. I Aweva says that my son has asthma from he was born and also eczema, and sorry. And once he had dairy, both triggers, and he had dairy, both triggers off. So, is it likely, now that she said that, I'm curious, does asthma normally present with other things or not really? So she
Yeah,
talked about having other,
eczema.
allergies, eczema, and so on. Yes.
Very common, especially among childhoods or with atopic asthma. You can have eczema, you can have hay fever, or what we know as nasal allergies. People, I also mentioned earlier that they can have chronic or recurrent sinus inflammation or rhinitis, which is a runny nose. So
Mm-hmm.
these are common associations with asthma. It's a similar mechanism of inflammation that triggers either the eczema or the hay fever or the asthma. So they
Yeah.
are a common co-occurrence, especially in children.
Oh, wow. Okay. Well, thank you so much for this very, very educational segment, folks. Again, Health City offers a variety of different experts across all fields. And of course, we have Dr. Archita, consultant pulmonologist, critical care and sleep medicine, Dr. Harsha, consultant pulmonologist as well, here with Shamari Scott, who's a chief business officer at Health City Cayman Islands. So, Shamari, another fantastic learning opportunity today. Thank you so much. I learned quite a bit about asthma. Occasionally we hear people who have a severe asthma attack and, they lose their lives. So this is something that, we don't want to scare you, but you still have to make sure that you're talking to the experts and getting the best possible medical advice about how to control your asthma and how to live with it, really.
No, definitely. And always thank Dr. Harsha and Dr. Archita for taking the time out of their busy schedule to be here
Mhm.
to educate us. I mean, I learned something today. My middle child had asthma from time he was a child. He's still a child, but much younger.
Mhm.
And the last, I want to say, year and a half, 2 years, he hasn't needed his inhaler. So we
Mhm.
started saying, oh, he's grown out of it. So now I need to
Mhm.
make sure that he has a pump that is up to
Mhm.
date and full just in case, because we really thought, we're like, all right, he's been running, jumping, and he hasn't
Mhm.
needed it for a year and a half. We're good. And even
Mhm.
I remember when he was smaller that one of the medical professionals we would have seen at that point in time would have mentioned that there's a chance he will grow out of it. So that might be a
Mm,
misconception that's there that hopefully we clear
mm,
that up. And even in my household, I need to make sure that we have that plan, Dr. Harsha and Dr. Archita, just in case.
No,
mm,
I
Yes.
mean that
So
is
it's
one of
not
the
like people can't
misconceptions.
grow out of it. Don't get me
Yeah,
wrong, or don't get
yeah,
us wrong. It's not like children,
that's
especially,
yeah.
when their immunological
Because
responses
yeah,
mature, they can grow out of asthma,
Okay.
especially allergy
yeah,
mediated. But let's not always assume it. It's always good to have a plan to identify symptoms early and to seek medical advice, not assume that, oh, he's grown out of asthma, so this can't be asthma. We're not
Right.
going to worry
mm,
about it. So,
Right.
that is what we need people to understand. You don't need to live with the paranoia that, oh, asthma is going to come back or it's necessarily going to come back. Not
mhm,
necessarily so, but it's always better to be prepared.
Prepared.
Prevention
Yeah.
is better,
mhm,
Got you. Got you.
mhm.
right?
Okay.
So,
And your
Perfect.
inhalers expire after a certain amount of time, like
they
any other
do.
Correct.
They
medication?
do. So it doesn't, yes, you can have a rescue inhaler for an intermittent episode, and
Yeah.
that is fine. That identify symptoms. If you're noticing asthma symptoms, and train your child when he grows big enough to use an inhaler to know where the inhaler is lying. Maybe if he does have intermittent exercise induced symptoms, tell their gym instructors or their PE teachers or their, this is where his inhaler is. And in case he needs any help,
Right.
then this is where it is, or so these are important aspects of, and nuances that we need to discuss with parents as well, especially when dealing with children,
Hmm.
because
Mhm,
they may not be able to
And
identify.
and the great
Hmm.
thing is the schools that he is at, based on the nurse that's there, they
Hmm.
actually ask for the backup inhalers so that they have it stored at school just in case
mm,
he would have forgotten or he couldn't identify it, especially when he was younger. So even within
mhm.
schools, they also have a mechanism there to make
That's
sure that
excellent.
there's a backup. Yeah.
And we are
Yeah.
really blessed here in Cayman that there is a lot of awareness. The school nurses are
Mhm,
very, competent. And even in primary care, I've seen excellent asthma management. It's only for a few people, where they don't have access or, do not discuss these issues with their doctors as well. So that's
mhm,
why it's important to know, yes, you may have grown out of your asthma. You may not have had a flare in years and years, but there's nothing wrong in getting assessed.
mhm,
There's nothing wrong in discussing it with your doctor or having a plan of action. Or when you identify your symptoms are feeling like or are, sounding like asthma, seek advice. What's the harm, right?
right.
Better controlled than
Mhm.
not.
Absolutely. All
Perfect.
right. Final question, Shamari. Can people make appointments with Dr.
Most
Harsha and
definitely.
Archita at Caymana Bay as well?
Most
Both
definitely.
locations.
So
Okay.
you can go on the app or 640-4040 info@healthcity.ky. And if obviously if it is in an urgent situation and you want to figure out when either are at
Mhm,
Kamana Bay, you can do that and you can actually see them there as well.
mhm. And Joseph says, can any form of immunotreatments be utilized
Yes.
for asthma?
Yes. So allergy immunotherapy is an option for treatment of allergic asthma, especially if we have identified the trigger and especially if these are triggers for which we do have allergy immunotherapy or what we know as desensitization therapy available.
Hmm.
But it's a long process, not 100% always a guarantee that one would be desensitized, but these are options of treating asthma. Harsha, do you agree?
Yeah, definitely. So we cannot say that it will cure them with asthma 100% because the allergens are millions. And
Hmm.
what we do
Correct.
is we only test for a subset of allergens which are common allergens. So
Okay.
in spite of treating them, they can still come up
Have
with
intermittent asthma.
again. So
Yeah.
because we have seen enough patients who have underwent immunotherapy and they come back with symptoms. So it is one way of treating it, but it is not the only way of treating it.
Hmm.
That's right.
I would say.
So yes, it's helpful in some people who have very
Yeah, not
few
all. Well,
allergic triggers. There's just one or two identified allergens that you can actually target and try and desensitize them towards, and it does work. It helps in overall asthma control, but it cannot be a guarantee that it'll get rid of asthma. That's
it
all we
would
need
be.
people to
So,
understand.
yeah, it would be helpful definitely. Like those who are with pets. So in them, at least they know that whether they can keep the pets with them or not, because they'll get to know that if that is allergic. If they are allergic to them or not. So it is specific in specific situation. It is definitely helpful. But yeah, definitely.
Hmm. And Ms. K says, would an appointment need to be made with a pediatrician or specialist for child testing?
It's always better to see a pediatrician to assess if they need specialist assessment. Pediatricians are better able to identify any other associated illness which may be triggering asthma. But if it's purely for asthma and if it is something which is not getting controlled with standard treatments, then yes, they can see a specialist. Both Harsha and I are adult specialists technically, but we do see pediatric patients with asthma per se. But it's best for that referral to come through a pediatrician. So I would suggest that they can see their pediatrician, let them, comb out any issues, any other issues, rule out other conditions, and even manage asthma. But if the asthma is still very poorly controlled or difficult to assess, we can always play a role in assessment, evaluation, and then, of course, in management as well.
All right, we do have a caller, question or comment for our guest this morning.
Yes, good morning to everyone. I don't know if
Good
this
morning.
is appropriate, but I want to know. I don't really have asthma, which I had two brothers. I mean, one brother and a sister that were asthma box. We used to call them. They were asthmatic. But my sister kind of grew out of it. She's the older sister than me. But my problem is, I want to find out, I don't know what is, but when I wake in the morning, like my nostrils be itching, and then I have like a snorting and blowing, and it's terrible. But then at the, as it gets later in the day, it normally goes. But every morning, right now I have that, and then like my nostrils be itching, and I be like, rubbing them till they get red and stuff. So I wonder what's that, what is that I'm developing, because I don't really have, short of breath or anything, which and then my other brother, well, after he died, because he was 62, but he dead now, and he had the asthma. He used to have that bad. He used to have the wheezing and the tightness in his chest. If he ride from here to top of road, he used to get, he was really bad, but he never did, overcome it. But my sister right now, she don't have it anymore. She used to live in New York, and when she was there, she found it cold, where it gets so cold. But, that used to bother her, but now she's in Florida, where Tampa gets cold, but not snowing and stuff. So now she's in her high 70s, and she don't really has it no more. So I don't know what's happening to me. But like I said, right now my two nostrils are, they itching, and then they're like stuffing, and I be smelling, like the regular inhalers, the all of us, whatever. But then as it gets, the day progress, it goes. But every morning I have it, because right now I have it. So
sounds more like maybe allergies or something. What do you think,
True.
Dr. Archita?
Yes, I agree. Sounds more like an allergy or allergic rhinitis, where where you're experiencing, or non-allergic rhinitis for that matter, we don't know, but you're experiencing itching and congestion in your nasal passage, which is perhaps related to some kind of an allergy trigger, and or to maybe just check your bedding, make sure everything is clean around, you're not exposed to any dust over there. Use hypoallergenic mattresses and pillows. And if this persists, then either follow up with an ENT doctor or see your primary care doctor, or even, if this is associated with chest tightness, wheezing, coughing, then you feel free to see either Harsha or myself, and we can help you, test you for things. And
there is something called as allergic march in asthma mechanism, where the symptoms start with
the nasal passage.
That's typically what she's saying. So when it is not treated, it will go down, and then they get this chest symptoms. So maybe that's what she is referring to, and she has a asthma history. That's why she's worried, I think. So
yes.
Yeah.
Hi, caller.
I don't know what happened. I got disconnected, and I heard what he was saying.
Oh, okay. So yeah, they basically said sounds more like allergies, and to just check.
I am 70 years old now, and I'm afraid to tell my age.
Yes. All right,
I'll
my
be
dear.
70 here if I live to see it, and I'm afraid that I don't hide my age.
Yes. Thank you.
That's
so
a good
much.
thing, ma'am.
Okay, well, I'll check with Dr. Warmer. He's my ENT. The
yes.
best.
That's a good idea.
Okay.
So yes, I mean, I also have the same thing a lot of times in the morning. Like sometimes people notice even here as I'm talking, my sinuses are impacted. And the second the show's over and I stop talking, they go back to normal. But I do know that waking up in the morning, one of the things when I went to the ENT that really, really helped me, maybe with the callers to listening, and I haven't been doing it lately because you know how we are once we start to feel better, we fall away from all the good treatments that we should be doing. But one of the things I found very, very useful is the nasal irrigation in the morning, the neti pot kind of thing, just, flushing. And
Yes.
years I've been told, do it. And I was like, and then I finally tried it. It really does help. Keep your sinuses clear, and dust mites, they're everywhere. No matter how much you clean, they exist. You can get air filters and other things to try to control them. No carpet, no curtains. There are things that you can try, but they're still around. So, I'm allergic to dust mites and a few other things. But yeah, okay. Well, this has been an amazing discussion. Let's address Duke, because Duke has put some stuff here in the comment, and we want to make sure that we're giving people correct information. So Duke says asthma meds kill eventually. Is that true?
Can't say that because asthma can also kill, right?
Exactly. So
we
asthma
shouldn't-
meds don't kill you. Yes, they're not completely not associated with any adverse effects for some people. Let's just put it as that way.
Yeah.
But again, when judiciously used for the right reasons in the right doses, in an appropriate manner, the benefit is far, far more than any harm or potential adverse effects. Definitely not death, but from any other adverse effects too. I mean, the benefit is far more. Yeah.
Yeah. And will breathing...
I'm sorry, Harsha, for cutting you off. I'm sorry. I just wanted to mention that does not kill part. You go ahead. I'm sorry.
I say that when we use it inappropriately, definitely any medicine would kill.
Yeah.
It's not like the inhaler or asthma medications. Any medication, if not used appropriately, that will have
That's a problem. Yeah.
Mhm.
And is deep breathing exercises enough to help you with an asthma episode?
Not enough, but yes, it helps for sure.
Okay. He goes on to say humans are born with smaller bronchial tubes, and that's what makes you asthmatic. But then everybody would be asthmatic, right?
Yes. So that's again a misconception. It's the inflammation in the breathing tubes that makes their caliber smaller, or the airways bronchoconstrict or tighten up in response to triggers. Whether the triggers are coming from inside, outside, we've already talked about it. But that's the inflammatory pattern or bronchoconstriction that leads to asthma. I'm not sure whom we are comparing to if you're talking about humans having smaller airways, but I think it's best to say that not everybody has asthma. It's not because of small airways; it's because of the inflammation in the airways or bronchoconstriction in the airways that people have asthma. Inhalers, when used inappropriately, can have side effects or adverse effects. But asthma kills definitely many, many more people than any inhaler therapy could even potentially, cause harm. So it's very important that we control asthma.
Mm-hmm. All right. Fantastic. Miss Juanita, good morning to you. Says asthma is very serious to me. My precious grand passed away a few years ago with a silent asthma attack. I also suffer from asthma too. Take it seriously, please. Thanks for your group of doctors, Sandy. So what's a silent asthma attack?
This is very unfortunate in the first place, I must say. Well, silent asthma is usually a clinical condition. It's not a silent asthma attack where the child will not have symptoms, but usually we as clinicians may not hear a lot of breath sounds going in and out. And that's what we call, a silent chest, basically, where you can have absolutely wheezing going on because the airways are so tight that the airflow is cut off. And that is a very dangerous condition to be in, to have a silent chest.
Oh my goodness. Irvlin says, thank you so much for all of this information. You are most welcome. Thank you to Health City Superstars over here. Another episode of Medical Rundown Tuesdays under a belt. Thank you so much, guys.
Perfect.
Thank you so much for having us, Sandy.
Sandra, thank you.
I appreciate it very much.
Thanks,
Awesome.
bye.
Have a good day.
Thank you. Bye. You guys too.
All right, folks, we've got over 400 people in the live stream learning something this morning. Desiree says oregano is also good, known as thick leaf thyme. Boil it and drink it and it helps my grandson with his asthma. So no doubt they said that teas and things like this can help, but speak to your medical professional. That's really the takeaway, to ensure that you're getting the proper and adequate treatment that you do need. So very, very good discussion this morning. So we're going to switch gears here. Let's do a little commercial break in between, and then we're going to take an opportunity to, talk about some of the other things that are happening in our community on this beautiful Tuesday morning.
I am Richard Hugh, President and CEO of CUC. Our focus has always been on you, our customers. Times are changing, and so are your expectations. We are listening to our employees and the people of the Cayman Islands to find new opportunities that can improve your experience. We are working every day to provide you with a safe and reliable electricity service. You are at the core of everything that we do. We are exploring and adopting new technologies and sources of energy which will benefit you as we become more reliable and more efficient, which will mean lower energy costs. We are working to improve our energy management tools, offer new products and services, and provide 24/7 customer support. Our new vision, empowering Cayman to be a global leader, is building momentum towards a better future for our islands.
Ocean Ridge Heights offers an amazing opportunity to own a piece of land in idyllic Cayman Brac, right on the bluff, starting from $80,000. Located in a quiet residential area with high elevation, these lots are ideal for a future home or investment property and are sure to go fast. Cayman Brac offers a laid-back lifestyle, amazing pristine diving, limestone caves, diverse flora, along with amazing wildlife. Inquire about the owner financing options so that you can secure your piece of paradise today. With only a few lots remaining, these are sure to go before you know it. Contact Crichton Properties today on 345-949-5250 or info@crichtonproperties.com.
Great news, Cayman! Tim Hortons is finally open and ready to serve you. Start your day right with our delicious all-day breakfast, or grab a box of our famous Timbits and a dozen donuts for a sweet treat. Need a quick pick-me-up? Swing by our drive-thru for your favorite espresso drink anytime. We're open weekdays from 5 a.m. and 6 a.m. on the weekends, closing 9 p.m. and 10 p.m. on Fridays and Saturdays, with 2 entrances at the Shamrock Road Roundabout in Red Bay. It's time for Tim's.
Recover Personal Injury Attorneys, helping injured people get what they deserve. Did you know that insurance companies have lawyers that represent their interests? Before signing and accepting any settlement, know your rights. Call us today for a free consultation at 924-9999. That's 924-9999. Recover. Your personal injury attorneys are on standby to assist.
All right, folks, welcome back. Welcome back. Happy Tuesday. How's everybody doing this beautiful Tuesday morning? Oh my gosh, what an interesting weekend. Long holiday weekend. So I know everybody was hopefully getting some rest yesterday. Some of us were working. I was here planning and working and, working out some details. CMR TV, oh boy, we're having a good time over here working on that plan. Content creators getting lined up. I'm so excited. And, if you're interested in becoming a content creator and you're probably sitting here going, Sandy, what does that even mean? Then you should reach out to me. Yeah. Your own show, honey child. Most of the people are going to be on both CMR TV and radio. So yeah, it's pretty easy to do. Well, maybe I'm saying that because, years of experience here, it might seem easy to me, but it's not rocket science, and we can help you bridge the gap if you are interested. So reach out to me personally and I'll tell you all about what's involved. I'm so excited because we have some amazing people coming on with some really fantastic shows. I was looking at some of the shows this weekend, talking to additional persons who are also interested in doing their own thing. And yeah, it's not for the faint of heart, honey child. You got to make sure that you have the necessary commitment. But if you've ever thought, wow, I could do a TV show, I could do a radio show, then this is definitely your opportunity. CMR is all about community, folks. That's what we're here for. We keep the community involved. We do things really at a community level. And so this is just going to be an expansion of that going forward. So, yep, talk to me. It's, talking to me is actually the easiest part of it all. So we'll figure out whether or not that's something that can work for you. So good morning to a lot of you. Siobhan Barry says that she definitely got a lot of rest yesterday. It was a good day. The weather was gorgeous. It was a good day to just take it easy. I know some people went to the beach. By the way, if you're going to the beach, be careful, honey chill. Someone was telling me that there are the jellyfish out there, and a little child, a friend of ours, got stung by jellyfish yesterday. So, she's gonna have to take some antihistamine and stuff like that. But yeah, be careful. They are out and about. And I think maybe in certain parts of the island, even more so. So, take your time, be extra cautious. They're not something that you can really see well a lot of times until you're actually in the water. So just know that they're some times of year that they are more active than others. Yeah, so there you have it. All right, let's talk about some of the happenings over the weekend. So I had a good weekend. On Saturday, I was playing what I call soccer mom. So much fun. You know what that is, moms, where, it's your turn to do the play dates. You pick up the kids and take them all out. So I had 3 young girls with me. 7, 8, and 10. And we all went out and had a fun-filled day. We did a little lunch first, and then we did lunch at Caymanians Bay, kind of went around. We had some gelato afterwards. Oh, there's a new flavor there that I tried that I really loved, but treat every once in a while. So we did that, and then we ended up going to West Bay because Sir John A. Cumber Primary School had their event. So we did that, which was fantastic. I'm going to put that video up a little bit later on so that you guys can see that. It was really, really good. And so congratulations to the school. They are doing a number of initiatives to fundraise for like playground equipment and so forth. I think they actually have the playground equipment already in place, but they're looking to reimburse, the donors or whatever. So it's a great initiative. I know that Joanna Clark PTA had their similar event a couple weeks ago. So this is great. We went out, we supported it. They had mountain castles, they had food. The fried fish was great. Whoever was in charge of seasoning that and cooking that up did a fantastic job. And there were a lot of kids out there, and they just had a really good time. So we ran into MPs, Mr. Ralston Anglin, and also Miss Julie was there. And then the kids had like a pizza night and movie night a bit later on in the evening. So yeah, we had a great time. And I'm trying to convince Marlon that, I need a bigger vehicle so that when I want to do these dates, and I love taking girls around and making them have lots of fun, that, maybe I could do even more of a friendship circle if I had like one of those 7-seaters. I'm just saying, a nice big Jeep 7-seater in my future, perhaps. Soccer mom mode, elevated. Love it, love it, love it. So that was Saturday. And then, of course, we had the meeting on Saturday evening. Listen, don't laugh at me when I talk about being a soccer mom, because that's like the epitome of, every mom wants to be like the cool mom that, you know what I'm saying, gets to take the kids out and have a lot of fun. But yes, they had a great time. And so we did that. And then while they got to come back to the house and enjoy pizza and movie night, I had to go to work. And of course, that meant actually going out and covering the meeting of the West Bay successful candidates, now MPs, at a joint meeting that they had. So let's talk a little bit about this joint meeting, because I can tell you guys that there were so many of, the crowd was fantastic. I'm not the best at counting people. I'll tell you, I'm not that person. Like some people swear that, oh yeah, I can just scan a crowd. And I know I'm not really the best at that, but I think at least there was between 500 plus people there, I would say. That would be my guess. If you were there, tell me what you think. But it was a full house, and there were people parked off on the side in their vehicles and stuff as well. So it was a great turnout in person, and it was also a really fantastic. So it was a really fantastic time, and we live streamed it, and we had over 800 people in the live stream. So I think collectively, that's a lot of people between them watching it and everything. So if you miss the live stream, go on the CMR channels. You can find it on, you can find it on, where was it? It has over 90,000 views already. Oh my gosh. Yeah, you can find it on Facebook, and you can also find it on YouTube as well. So lots and lots of people were watching it. Now, my apologies. I have to apologize for something as it relates to the camera. Oh my goodness. Facebook is sometimes the bane of my existence. It gets on my proverbial nerve, my last nerve. But what you guys were seeing was not what I was seeing. I actually had the camera in horizontal mode. So I was seeing a full video of it. Meanwhile, it turns out that you guys were actually only seeing it in like vertical mode. So when people are like, oh, back up the camera. And I'm like, why would I back up the camera? Normally you guys are saying I'm not close enough. And then as the evening went on, I did back it up, taking your advice. And everybody's like, okay, that's good. That's good. Because I was using multiple cameras to stream to different locations. Afterwards, I realized that one particular one, because I was using the native Facebook application, wasn't actually streaming it properly at all. Oh, it's so frustrating. Because there was a time, believe it or not, when Facebook actually, whatever you were looking at was what the people saw. Apparently, they don't ever tell you that they've changed these things. Apparently, that's not the case anymore. So that's fine. Now that I know, I will try my endeavor best to actually not use the horizontal mode, not from the actual app itself. Because if I don't use it from the app, if I use my other thing, it's fine. It's weird. Anyway, sorry about that, and I will do better. Now that I know better, I will do better. All right, so we will. We've got that under control, because I recognized afterwards exactly what happened. I was like, how? But how? And then I went back and I looked at it and I thought, tisk, tisk, tisk. What a hot mess. So it was a good meeting. It was actually a really, really good meeting. And like I said, the turnout was amazing. And there were so many, thank you. There were so many Caymanians. I was glad to see Caymanian faces. Those were the most that I'd seen in such a long time. And people were genuinely happy. Oh my gosh. So many people happy with this coalition government. Not for nothing, but most people are just like, progressives again? No, thank you. And so the vibe was positive. A lot of people were just like, yes, they're here for it. They love it. They are on board 1,000%. And what can I tell you? Except that, people were just really, really genuinely happy. So let me show you, I'm going to show y'all a little bit of the meeting in the correct mode. So this is what I was seeing. My poor little camera almost dropped there for a second. But this is what I was seeing. Of course, afterwards, I realized that you guys were not seeing the full stage like this, unless you went to the community page, because the CMR community page actually had the right orientation because we were using a third-party app. So it was a good meeting. All 4 of the candidates in West Bay, Ms. Julie Hunter, Kathy Ebanks-Wilkes, Mr. Ralston Anglin, and of course the new premier who'll be swearing in ceremonies at 2 p.m. today, folks. We will be carrying it live here. So of course, make sure that you tune into that. Somebody said to encourage them to watch CMR on the YouTube channel. Absolutely. Coming to Cayman today, you are? Oh my God. What? In dire conditions at Health City? What? You are? Oh my goodness. This is one of my media journalist friends. What is she? She's in dire condition at Health City? What? I thought she was just coming to visit for the swearing in. She's from the Miami Herald. I was going to say, oh, that's nice. Oh my goodness. Oh, I got to visit her. Wow. Oh, wow. Okay, I got to get those details. Like it just popped up on Messenger. Oh, so she's coming from Miami to here for treatment? Or where's she coming from? Okay. Oh my goodness. I got to get details. Oh, wow. Sister. Oh, her sister is in dire. I think she's met her sister, not calling me sister. Oh, those commas. Sister is in dire condition at South City. Oh, her sister's here in Cayman. Does she live here? I'm confused. I need more information. All right, we'll get the information. Okay. Whew. All right. Oh gosh. All right, let me touch bases with her. Because you guys know, as Caymanians, when people come, we want to make sure they're taken care of, that they're okay. Do they need a place to stay? Do they need, that's Caymanians for you. Y'all talking about Caymankind. That's who we are. Anyway, yeah, so it was a good meeting, and okay, I'll get more details on that. So yeah, it was a good meeting. And you know what I was shocked to find out, but I guess I shouldn't really be. This person says this is a monumental day for all Caymanians. Hallelujah. I really shouldn't be surprised when I think about it, but this is the first time that West Bay, and you guys are free to correct me if this was wrong information, but apparently this is the first time that West Bay has ever had 2 sitting female representatives. Wow, is that right? Boy, West Bay, y'all behind the times. I'm glad you finally caught up with us, because it's so nice to have more women. Only got 5, but wouldn't it be nice if we had 50-50? Because over 50%, my apologies, of the population in Cayman is actually women. We would like equal representation in our legislative assembly, and maybe there are some things that would, move forward a little bit better if that was the case. So congratulations to, all of our elected MPs, but especially the women who we are expecting great things from in particular. Move the needle forward as it relates to women's issues, please, and thank you. So yes, take that. Women leading the way now in West Bay. Isn't that amazing? I love every minute of it. I got to tell you the truth. All right, so first time. No, that's because McKeeva Bush was sitting there seat warming for over 40 years. My Lord. I cannot believe that you guys kept him in office that long. But the good Lord is good. That's all I can tell you. He's finally unseated. He's out of there. And you know what? No ill will towards Mr. Bush. He served his time. Thank you for your service, sir. But at some point in time, I think that everything expires, and, you long expired. And so you got to know. And, I actually said this to him last election. I said, sir, I think it's your time this is your last 4 years. Of course, he was lying to us like Auntie Julie there, telling us about how she was going to retire. And he was kind of doing the same thing, lying to us about that. And he had no intentions of leaving. But at some point, you got to know when to fold him. And so finally, he's out of here. And we wish you well with your retirement. Now, did you guys hear what he said? I think I might put up this story a little bit later on today, but apparently he's of the opinion that the issue and why he lost was because of one man, one vote. Oh, honey child. When it was working from him, we didn't really hear any complaints, did we? Mm-hmm. But now he says that one man, one vote cost him the election. How about your behavior over the past 20 years cost you the election finally? And can I tell you something? I'm so glad that a woman unseated him. Mm-hmm. I am tickled pink that it took a woman to do it. The men tried, and they tried, and, you know, couldn't get anywhere. Somebody said he lost because people saw the truth. That's right. And I don't care how many, even if it was just one of you, y'all finally saw the truth. It might not have been a landslide win, but a win is a win, honey child. So I absolutely love that a woman was the one who finally took him out. You go there, Miss Julie, and she did it with a nice, clean campaign. She didn't do the mudslinging that he was engaging in and, you know, going around calling women all sorts of derogatory names like he likes to do. All right, so shout out to Ralston, of course. He was there, slated to be, as of today, the new Minister of Education. Kathy Wilkes was also there, and Mr. Andre brought it home with some nice comments, getting the crowd all excited. And I can tell you what, folks, when I tell you that the crowd was excited, that's no joke. They were on cloud, I don't know what cloud that would be. Not even cloud 9, like cloud 25 or something. This person says, it's so proud to be a Caymanian. I feel sad that I can't make it to the swearing in, but everybody who can make it should. This is a monumental day for all Caymanians. So indeed it is, and it's a fantastic day to go out there and get to see your representatives. And, you know, this person said we could have had more women if Red Bay voted Natasha in, but nope, they voted in Roy Tatum, who didn't bring a thing to the debate or community. Yeah, I must tell you that I was extremely surprised by that win. I didn't see Roy Tatum winning at all. That was really shocking to me, but it still demonstrates the groupthink as it relates to the progressives, that there are people who are just going to vote for them just because it's the progressives, no matter what they throw at you, which to me is just so incredibly shocking. Wowee. I mean, remember early in the election when I asked that question, are you going to vote for the party or the most qualified person? The PPM members were sitting there silently not voting or participating because they knew all along that party trumps individuals' qualifications for sure. Really, really shocking. Good morning, Miss Yulene. So nice to see you. Marva says, good morning, Lady Sandra. Thank you, ma'am. How are you? Goes on to say, I do so love Cayman. Listen, we love this country, you know, for different reasons, I think. But at the end of the day, we have to do our best to protect what it is that we love so much. And so that's why I say, you know, all of you undesirables that come here, believe me, we have no qualms in calling you out for who you are. Because most of you come here because you're running from something. There's something unique and different and lovable about Cayman. And that's what we need to protect, right? So if you're coming here because you're running from crime or bad weather or all these other things, or, you know, over pollution, all these things, environment, don't come here and then try to change it and make it where you left. That doesn't make any sense. Morning to Jerry. Says jellyfish come out between Mother's Day and Father's Day. Yeah, I guess this is their season now. So be careful, folks, when you go out there. Ooh, it's Carnival in St. Martin. Desiree says that she had a good day yesterday at Carnival. Nice. All right, Miss Joy. I got to meet Miss Joy at the meeting. She's always on here. So I felt like I had met her before, but in fact, I don't think that we ever met. So that's my good friend's aunt. And it was so nice to see her. Back and forth between Texas and Cayman, but Caymanian, of course, always your home. APOC 447 says nothing beats the practicality of a minivan regardless of how uncool they look. Well, I tell you what, honey child, yes, YouTubers, some of them looking real nice these days, like really nice. I saw one the other day at Car City, and I was like, oh my God, what is this? This vehicle is beautiful. Beautiful interior, beautiful exterior. It's a little bit longer than mine by about 10 or 11 inches. And you get that 7-seater feel. And yes, I'm all about, being the escort mom to take people around. Loved it. All right. So Anthony says, what happened to all the unsuccessful candidates and PPM MP elects? I don't see none of the emancipation celebration in town last night. I guess they're gone in hibernation for the next 4 years. It's so sad. The quality of candidates, they're all know the general public 3 months before election. So let's talk about this, Anthony, because like I said, McKeever Bush is licking his wounds, and he is talking about, we need to change the voting system from one man, one vote. Because I guess he felt like he had a better chance at getting in. Then we have the progressives over in the corner, also licking their wounds, being equally as salty about, this is a marriage of convenience. Well, let me try to say this. When it comes to marriages of conveniences, the PPM, they have perfected that. They have perfected a marriage of convenience. So they should know one when they see one, because they are the purveyors of it. They're the experts at it. So touche, honey child. Don't worry about it. And so one of the things that they did at the meeting was they explained how this came about so quickly, because we did see that last time the progressives were hell-bent on, although a government had been formed and they'd come together and sign something, they had to quickly get to the governor this time around to prevent what happened last time from happening again. So I'm glad that they did it. They said they hunkered down immediately. They worked it out amongst themselves. Now, I heard of some rumblings of negotiations, and I'm really not going to say anything about it at this stage, because what I will say is part of the negotiation process, folks, is, you might have disagreements. So some person might have said, how about Sabrina for Speaker of the House? And then a particular person might have said, oh, no, we can't put her in because they feel away. They might be feeling salty in their own feelings, although they won. I'm just saying. So these things happen. Negotiations means it's back and forth. And so, it is what it is. Like I said, I'm not going to make a big deal out of it, but I am keeping a very, 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 very close eye on people. Don't be a sore winner. Some people are sore losers, and some of you barely won. Don't be a sore winner. Get in there and focus on the people's business, because we've hired you to do a job. Set the negativity aside. Leave that for me to do. You get in there, you be positive, and you do what you got to do. Good morning, caller, honey child. How are you?
Good morning, Sandra, honey child. How are you doing this morning?
I'm not too bad. Tell me what's going on.
All right. I sent you a voice note. I don't know if it was Sunday or whenever.
Okay. Which phone did you send it on? The one that you're calling me on?
Yeah.
Okay. I got to check that phone.
Am I seeing correctly and seeing my 4 eyes this morning, seeing correctly that there was a hit and run on 7 Mile Beach Road?
Oh, my God.
Someone said it in your comments on YouTube. What about the hit and run on 7 Mile Beach Road?
Well, I don't know if there was one on 7 Mile Beach Road, but there was definitely one here in the Savannah Newlands area where the person was crossing over by Wendy's trying to go to the gym. And that's a former MP's wife. I was shocked.
Yeah. So listen to my story. And I have had to call the last few months. I have been calling for a police presence. I have called in once before and said this on your show, and I have called in and said it on Radio Cayman talk show. And I have asked and I have begged Sandra and I have pleaded because I use the road to exercise most days. Twice you will see me walking. Some people might think I'm crazy, but I'm not crazy. I exercise to keep me fit.
That's right.
Because I live with a medical condition and I'm trying to live a little bit longer regardless of what Cayman and the people think about me and what I have. I am sick and I am tired of having to wake up in my country called the Cayman Islands. And I want every Caymanian that is a Caymanian to listen today. This is one Caymanian that is going to speak up.
Yes, ma'am.
The Royal Cayman Islands Police Force. I'm going to correct you there, Sandra. I'm not a ma'am, I'm a sir. But my voice don't change till I get good and angry, okay? But I'm a very pissed off Caymanian man this morning. I lost my life and I came back on Sunday in the vicinity of Pampered Punis. I was walking, coming down from my walk with my umbrella, my backpack on, facing traffic. Pampered Punis would be on your left.
Okay.
I'm coming from up at the road, Conch Point Road, which goes all the way down.
What is Pampered Ponies? That's a business?
Pampered Punis is one of the oldest horse businesses in Cayman that carries our tourists out.
Oh, that's Mr. Rivers. Is that him?
I don't know. I think a couple called the Cat used to own it before.
Oh, okay.
And I don't know who owns it now.
Oh.
But that is there. There is some land. It's not developed. And I am facing traffic walking down towards Papagallo condos and so forth and Barker's area there. And here I am looking at this black. I want us to listen in. It was a black 2-door Mercedes, beautiful coupe convertible with 4 women in it, 4 foreigners, okay? And the woman was swerving and speeding in the middle of the road doing 70. And Sandra, when I saw it, I jumped out of the road. And I turned around and I looked to my left, to my right, down towards Papagallo. I saw a car coming. It was far enough for me to see there were no cars coming in the other direction where she was going towards Conch Point Junction and Captain Reginald Drive. She slowed down because there was 2 cars in front of her. But I called her a nice name. I called the police station and it had taken about 5 calls. Yesterday, I finally got an officer, a community officer that listened. Miss Kelly Coe, I think her name is. Congrats to you. Give her 5 kabooms, please. I have asked the police, and it took some begging to do, it seems to have been, before I reached this community officer that listened yesterday, to tell them the video from the CCTV needs to be pulled, and I'm filing charges against that woman.
Wow.
She needs to come off of the road. She was obviously drunk, in my opinion, because that time of the day, afternoon, Papagallo brunch just finishing, honey. So you know, if I want to find out real quick who she is, I can go straight to Papagallo and ask for their outside footage too. But I put it to the police. But I'm going to call some names here this morning because I got some names in our police service. You talk about what you call them today, these unscrupulous foreigners amongst us. Well, I hope all of them listening today. And I want to call out the Royal Cayman Islands Police Service for what they are, a joke force. We have a Caymanian Commissioner of Police, Mr. Kurt Walton, who myself have watched come up in the ranks. And I have told the officer this, that I used to be a proud Caymanian to say, finally we got a Caymanian at the helm. He got to do something. Well, that went out the door. I told the officer, the community officer, I don't have no respect for the Royal Cayman Islands Police Service no more. They want it to work. It has to be a 2-way street. You can no longer sit down, collect a bloody salary in my home called Cayman, and me go exercise on my home road
and get
run down.
Yes.
And get run down. And you want to hear what some feisty foreign officer told me? I got to tell you, I got his badge number. He going to be the first one to pop it on this morning. Badge 180 Clark. CLARKE 180 Clark CLARKE. Because I was upset like I am now, didn't swear to no police officer nor nothing. I was upset. The young lady that answered the phone, this is Georgetown Police Station now, okay? And look at Georgetown Police Station and ask me, why is it that we have a derelict building sitting there that we don't know is being used or not and doesn't even have the police signage on it?
Wow.
But yet, Miss Juju, my cousin came right. Who not preneur no more. Oh, Juju, go sit down in the ground. Come on, bright, feed your people with your bread time. You and the rest of the PPM bandits that have ruined Cayman. You give them $7.7 million, Sandra, and we have no police station. Your police commissioner, Mr. Kurt Walton, is unreachable. So Mr. Clark said this to me. After I told the young lady that answered the phone, I demanded her name. And he's in the background going, he wants her name. He comes on the phone and he says, hello. I said, put the young lady back on the phone. I want to know her name. I want to know her name. He can tell me I shouldn't call police station and carry on. So,
oh my gosh.
And then the man said to me, I said, I am calling the police station to tell you you need to put a police presence on the Conch Point Road and Birch Tree Hill Road because I almost lost my life. And you're telling me I am what? I mustn't call police station and tell you that. So here what the man tell me. The rude foreign riffraff police officer collecting my money, because my money have paying him with the rest of my people. Okay? My Caymanian dollars. When we go supermarket, we pay import duties so that paying your salary. Okay? You are a foreigner in my country. Hear what he tell me. I am sick and I need help. That's what was said to me. And it has been put down in the report I made. And I told the officer, the community officer, I was coming on Cayman Mall Road to say what happened to me. And when I'm done, the commissioner of police better meet me. She says, does he have to wait till Wednesday to call? I said, no, you can tell him he can call anytime after 10 o'clock. I will be waiting. But he can call and talk to me. I am going to say this to these rude foreigners in my country. In one no-use term, I said it the other day when I called into you. The U.S. has now come out and said, any green card, not any, to every green card holder in the United States of America, you are a visitor. As such, conduct yourself as one. Kaboom that. But tell them kaboom this. Tell every foreigner in the Cayman Islands, whether they own land or not. Because I got called out that face the little old white man down the road here again on Conch Point Road. 233 Caliste Drive. I got video, I got send that to you too when I told him out on the beach down there. 233 Caliste Conch Point Drive. I hope he listening today too, like every other no good riff-raff foreigner that have been given the gift of a lifetime to come, live, and work amongst me and my people. You better start respecting now, Cayman. Caymanian, everything above this earth that we call Cayman Islands and everything below our Caribbean Sea. Because the foreigners are the ones that have depleted every small juvenile fish from the shorelines and the iron shore of West Bay here down on Conch Point Road. They're out there with the 3, 4, and 5, and 6 rod and reels amongst the two of them and the hand line. And when you look at them and ask them, do you know the law? No, I didn't know we can't catch fish under 8 inches, but thank you for telling me. Oh, really? So every foreigner listen and listen good. This big mouth Caymanian, Cayman brag, and tell all you like it is. Cayman is for Caymanians. Caymanians. No matter how you got it anymore, you better start respecting the generational Caymanians here. Because there are ways and means of getting status taken from people.
Well, apparently it's very difficult to do, but we need to have that amended.
Yeah, we can soon have that, like I said, world recession coming, and there going to be no American tourists coming to these hotels or restaurants, and all these foreign workers going to go home. If you think COVID bad, wait till the world recession comes. But to every foreigner in my country, I'm going to end on this note. You have been given the gift of a lifetime. A lifetime. When you come here, you live amongst us, you get to know us, you immerse yourself in our culture, our history, and our heritage. Because if you can't do that, then let me tell you what you can do, and I'm going to remind you who you are and where you are. This is the Cayman Islands. There is no Grand Cayman. It is Grand Cayman, the big island. Little Cayman and Cayman Bright, the sister islands. Get it straight. Those three little small dots on this map called the world represent me and my Caymanian people called the Cayman Islands. When in Cayman, you are a visitor. All of you foreigners are a visitor in my country, a visitor. As so, please conduct yourself as a visitor. And to Mr. Kurt Walton, your ear holes better be listening because I'm waiting on your call. You, sir, are a disappointment to me and my Caymanian people. And I'm speaking the truth. Because if one of your filthy, rude officers, police constable can say to me as citizen of this country, the Cayman Islands, that I am sick and need help, I told the community officer he needs help because I'm not only going to see, he's not going to be suspended. I am looking for him to get fired.
Oh my
and
goodness.
I'm going to do everything in my power to achieve that. So Mr. 180 Clark with an E-C-L-A-R-K-E, you better watch your bike.
Okay.
I am going to hit this last note. There is a rude young lady at the governor's office, her name Lucy or something.
Oh my goodness.
If I got it right. A couple months ago, I called to try to get to meet with the governor to ask her to get to the commissioner and tell him what's happening on this road. It has taken me to almost lose my life. But that rude English woman, as far as I remember, her name was Lucy or wherever she come from. This is for her. You are here in a capacity, however you got here, honey child. You, Miss Lucy at the governor's office, are a visitor in my country called the Cayman Islands. And you as such, young lady, will conduct yourself or I will get rid of you also. I will do everything to get you fired too. And I hope Mrs. Jean Owen, our honorable governor, listening. And I hope Mr. Kurt Walton, our Caymanian police commissioner, is listening this morning. Because when he needs to go, get on the road, put his community officers on the road in our district and tell his police constables, roll their windows down and get to understand what is going on and what is happening in this country called the beloved Cayman Islands that we have to live in. Because as we have been told, we Caymanians not going to know where to go. Really? We not going to know where to go? No, we got a lot of places to go. Cayman is but a dot on this map.
All right, leave me there.
And that same police officer that called me stupid, I've seen the Russian border and I've seen Norway. Okay? Because I've been there. So tell every visitor, every foreigner that is a visitor in my country, when in Rome, conduct yourself as you are in Rome. You follow the Roman principles. Because I've said this before. If you disrespected the Romans and did what you did, they killed you. Cayman will send you off of here, you unscrupulous foreigners, visitors to my country called the beloved Cayman Islands. You get that straight. You conduct yourself as you are a visitor in my Cayman Islands. Thank you, Sandra.
Thank you, my dear. I appreciate
it. I hope that driver is caught, and I will make sure that two-door black Mercedes coupe convertible. It has a specialized license plate number. So anyone that knows who this white woman is, this foreigner visitor in my country, get to the police and tell them who she is so they don't have a problem going to pull the CCTV. When they pull it, they'll have a name to match from her driver's license here in Cayman. She need come off of the road, but I file in charges. Thank you, Sandra. Have a blessed day.
Thanks, too.
Goodbye.
All right, bye-bye. Okay, yes, I remember that caller from the other day, actually. Good for you, honey child. Yes, sir. Can't say that I blame them because somebody just said that they might have thought it was Westbury Road because I said Wendy's, but I didn't specify. My apologies. I didn't actually specify which Wendy's it was, but it was Wendy's Savannah. somebody that we know, like I said, wife of a former MP, walking across the street, minding her own business to try to get over to the gym, was mowed down in the road. Thankfully, her injuries don't seem to be too severe, and I think she's going to be okay. But goodness gracious me, I couldn't believe it. I was like, what? Another hit and run. Apparently they ran at first and then they must have thought about it. They probably thought about Mall Road. They're probably like, oh shoot, we're going to end up on Mall Road. So they turned back and then came back. By the time they came back, the police was there. And so was her husband. And they, all live right here in the Savannah area. So absolutely shocking. And I'm glad that she's okay. But yes, y'all need to be careful on these roadways. And listen to me, if you've had too much to drink, please get a designated driver who hasn't had anything to drink, because at the end of the day, your judgment is compromised once you have had alcohol. Stop putting other people's lives at risk because of foolishness. Lucky Body said, do you know if the Brat School will be going ahead, seeing as the PPM are now on the opposition? So this was the very first question that I asked, in fact, Lucky Body. And what I can say is that at the end of the day, they're going to have to look at it very, very carefully, because there might be some things that she's committed them to that they can't change. And maybe there are some things that they can, but they're going to have to look at it. But hopefully they will be in a position to look at it with a view to not having this exorbitant school with all these extras that the kids at that primary school or at the secondary school simply don't need. I'm sure they can cut back on the budget. But again, contracts are enforceable. A lot of times you will be penalized for breaking a contract. But if the penalty is less than the savings, then obviously that makes a lot of sense. So I think that the government has a good sense that this is one of the key things that they need to prioritize pretty much right away. So let's see how it goes. What a mess. All right, radio listeners, radio is now off. So of course you can join us on social media. Okay. All right, so let's continue. So yeah, that wasn't 7 Mile Beach. I was thinking, was there another one in 7 Mile Beach? That was Wendy's Savannah. So pretty crazy. And then there were 2 accidents. Did you guys see these 2? I understand that they pretty much happened in almost the exact same spot off of or close to Moonbeam Drive. One was last night, and then one was on Saturday night. The one on Saturday night, the car actually flipped. I was like, what on earth is going on here? Whoa. The one last night, 3 cars, all mashed up. And I just couldn't believe it. I'm just like, what kind of driving is going on? Hearst Road is not like a 25 mile per hour zone. Given the fact that it's so close to the actual, like the homes are close to the roadway, there's not any sidewalks or shoulder really. I think that you guys really just need to slow down and take your time. It's not necessary. Look at this. Look at this. I mean, mash right up, head on. And then I don't know how the third one got in the mix. But I mean, as you can see from the parts and the vehicles and the parts that are off of the cars, this was quite a substantial lick. And I'm just like, how? How are you guys doing that? Look at this. Look at this front car. Windshield mashed up. Front all mashed up. Looks like part of the engine on the ground. Good morning, caller.
Good morning, Sandy. I was listening to that. She sounded like a Caymanian.
It's actually a man. We should apologize because the other day when he called, because of the voice, we all assumed it was a woman. And he actually just corrected and said, no, he's, Well,
I apologize if that offends him, but what he was saying about
very sensible comments.
What he was saying about spewing his venom about the foreigners do he realize that is not Caymankind? The reason why foreigners, and I've talked to foreigners or immigrants that have been here, and they said, why do Caymanians want to treat us the way they do? It is so sad. We as Caymanians have to show empathy. These people come here because they need to. And they're not taking away anybody's jobs. They're doing what no other Caymanian would want to do. How many Caymanians out there that would want to clean the backside of these elderly people? Just, it makes me so sad. The only thing you can do with people like that is to pray for them, because they have nothing positive to say about anyone. But I'm certain if the Caymanians made the immigrants feel like they are humans, then they would be more than happy to associate. But the Caymanians are distancing themselves from these people. I have a Filipino, and I'm Dexter. I don't care who likes what I'm saying. I have a Filipino. We treat her like she was family. She's like family. She's a sister that my wife didn't have. We treat her with every bit of respect. We trust her. It's so sad that we have become who we truly are. And that woman needs to get herself some positive in her life. The only thing you can do with people like that is pray for them and hope they'll make a change, because she is one negative person. I listen.
Well, I think let me perhaps give you a little bit of perspective on it, Mr. Dexter. I think.
Just a minute. No, I'm not saying that. I'm not saying that foreigners or immigrants that is in authority does not treat Caymanians bad.
Mm-hmm.
But that does not mean every immigrant that come here is a bad person. Sure, there are police officers that I wouldn't want to be associated with either.
Mm-hmm.
But I got to show them respect. And the problem is that people got to understand that the first thing, if it's a immigrant police officer, the first thing they ruffle their feathers. Oh, I'm a Caymanian. No, and you don't do that to somebody in authority. You just go along with the flow and then report them to the commissioner of police or anybody else, or to their boss.
Mm-hmm.
So I'm not generalizing about that it does not. I'm not saying that it does not happen. Sure, it happens, because it happened to me.
Mm-hmm.
But I'm not going to go overboard and call you about, putting it on the radio about that. Mm-hmm. It's done in such a bad case.
Well, I think. Yeah, let me say this, Mr. Dexter, to kind of maybe put in a little bit of context, right? I mean, obviously people call in here and they vent about a lot of different things. And this gentleman is venting. Obviously, he has had some experiences where, I guess foreigners have put themselves in a bad light. And he's simply reminding them that when you come to Cayman, as he said the other day, when you're in room, you do as a room and zoo. That really is the overarching point. I
totally agree with that.
So I didn't think his call went overboard. I mean, he wasn't threatening anybody or anything. He just said that the law is there. And if you're driving around like a lunatic, almost mowing people down in the road, you're going to be reported to the police, and he expects a certain type of response from the police. And when he's not getting that, he's obviously expressing his displeasure with that. It's coming from a place of frustration. And I mean, you yourself have felt that frustration. I think a lot of times you've called in on the program and probably have said things where people are like, okay, obviously this is something that really bothered Mr. Dexter. So, I'm not going to take it anyway. I think the last call might've been on election day, and a lot of people really appreciated the call and appreciated the comments. And so Listen, we all have foreign friends, and I believe in treating people with respect, but we also need to be treated with respect in our country, right? I don't go to anybody else's country and disrespect them in their country. If I'm a visitor, I act accordingly. And really, that's all Caymanians are asking people who come here. But after you've had experience after experience, Larry and Linda, Chris and whatever her name was, you have enough of those and your patience kind of begins to run thin. So
Yeah,
that's probably what has happened here.
I totally agree, but we cannot put every.
But I don't think that's what's happening. Because remember what he said at the beginning of the call. He said, I'm talking about the ones, as you say, the undesirables, the ones who come here and don't do and act accordingly, right? They don't want to abide by the laws. They don't want to.
Well, I didn't get that far, and I apologize, because I apologize for even calling in, because he had a right, because he made a point as to why he was calling in, and I apologize to him for that.
All right, my dear.
Okay, then.
Not a problem, darling. Have a good one, you too.
And there's a breath of fresh air in government again.
There's a what, sorry?
There's a breath of fresh air, and the sun is shining so bright.
Most certainly, most certainly. Thank you, my darling. Okay, good.
Okay, bye.
Yeah, so, perspective, I think, is certainly a hell of a thing. And, I didn't take the caller's comments to be overly aggressive in any way. I think a lot of people are appreciative, in fact, of the comments. So it is what it is, honey chill. All right. So yes, a number of really crazy accidents over the weekend. Not sure what's causing all of these accidents. Slow down. Speed does seem to be some sort of a factor, because again, when you see vehicles looking like this and they're supposed to be 25 miles per hour, I'm like, okay. I guess you can do that much damage at 25 miles per hour, but please slow down. Stop your drinking and driving, because some of y'all are definitely doing that. And also just cut out, the talking on the phone and everything else that could potentially be distracting you. Oh, what a hot mess. Okay. So the backbenchers actually have, Anthony, to your question, they have a really, really important role. He's asking if Makiva Bush will be attending the swearing-in ceremony. Well, they all have to be sworn in. It's not just the ministers. They all have to be sworn in. So this is where they get their appointment as MPs. Now, I don't know if Chris Saunders is going to be there. Apparently, the day after election, he was off island already. Him, his wife, and sister-in-law jumped on a plane and they were out of here. Boy, Baden Towners, I'm so disappointed in you guys. You really were somehow fooled by this man and, put him right back in. But anyway, he went off island. I don't know how soon he will be back, but thankfully, they will. Oh, I'm sorry. Oh my God. Oh, for a second there, 40-something years. My apologies. Somebody said Makiva didn't get elected. Geez, I'm peace. Yes, he didn't. My brain is still getting used to that after how many years he said he was in for? 40 odd? I think it was 19. Was it 1984? So somebody was saying to me yesterday, so Sandy, you mean to tell me that in 41 years, this man has never gotten out of office? I said, no. 41 years straight. Wow. So no, he did not get elected. Whew. So I don't know if he will actually, it's a good question. I don't know if he'll be there or not. I mean, he seems a little bit petty, so I wouldn't hold my breath for him showing up. But yeah, what a hot mess. Honey chill. Anywho, I wonder if he will be there. I don't know. Your guess is as good as mine. So yeah, I was saying that the opposition has, an important role to do, and I suggest that they go about it. They're supposed to be the ones to keep an eye on the government, and that's what we expect them to do. We're all going to be keeping an eye on the government. I think it's a government that we definitely wanted, but that doesn't mean that they're going to get a free pass. They need to go in there and focus immediately on the people's work and try to get it done. So Siobhan Berry says, congrats to Rolls in England, proud of you. And I know my mom would have been proud of you as well. Aisle 2025 says, I'm still shocked about Roy Tatum. I mean, honestly, Gabby says, I voted for Natasha. I thought she would have gotten in. I'll tell you that even Sabrina not getting in surprised me because she was just 16 votes shy. But it's a democracy, ultimately. Al Ray says that Kurt Tibbetts and Alden equals Roy Tatum getting elected. And I guess they're working overtime to make sure that happened. So Gabby says, so what's happening with Sabrina? Is she still in prospect? Well, she got voted out, so no. Her office, she was cleaning up her office over the weekend. She's had that before she even got elected last time in preparation of a successful victory. And now she's going to be giving up that office. My understanding is Roy Tatum has already contacted the landlord about taking the office over. So he's going to be doing his office there. This will actually be the first time that Red Bay has ever had an office that people could go to in a very, very long time. So I think it's good that Roy Tatum is at least going to have an office. So yeah, he will be taking over Sabrina's office apparently. So she was busy over the weekend cleaning out, and then we'll have to wait and see what is next for her and what she'll be up to. Good morning, caller.
Good morning, Anna. How are you doing today?
Morning, darling. How are you? Not bad.
Yeah, right. Yeah. I'll tell you something.
Mm-hmm.
I don't know if you know anything, if you could help me out over.
Mm-hmm.
I've been hearing the rumor that the MP from Downtown West, allowed in offices and administration building offices and other offices, and he could never have the potential of becoming a minister or something. Do you know anything about that?
Well, I heard it. And let me tell you now, I heard it from someone who is an elected member, and they were told it by a senior civil servant. Now, the governor has never officially, and I can certainly put the question to the governor's office, the governor has never officially said anything about this. So we don't know. And this is sometimes where I do wish the governor's office would communicate with us a little bit more about certain things, but they haven't. So I can't say definitively that's the case. I can only say that I've also heard it from multiple sources. But you know what? I'm going to ask, and I'll see if they will inquire. Is it possible? I suppose maybe it's possible, because remember now, he's had an issue with the previous governor, and that escalated into something. And then also the civil servants, there's been a pattern of behavior and allegations that were brought against him to the deputy governor. And so the deputy governor actually had to come forward and ask the then premier to do something about it. And that's why he was terminated. So I don't know. I mean, I can't say for sure, but maybe on the low key, they're saying to the elected members, we don't care what you make him in a government, but don't make him a minister where he has to come in this building. But I'm going to ask the question.
That would be, I hope, first of all, I hope it ain't nothing that the governor's office or anybody else is hiding that preventing this thing, because that I would look at that as being corrupted. And secondly, that would be a disenfranchisement for the people that voted for him.
Well, I mean, they had all the evidence beforehand, though, right?
Yeah, but they voted not knowing an official word on the situation, because if it was anything written in the books, I mean, the elections office stopped candidates from running already. The little guy in West Bay, because he had something against him that they found out to stop him from running. So if they had no anything about this and never said anything, then that's a disenfranchisement. We'd have to have another election up this way. That's why, sir.
Well, I'm going to actually ask the question because it is a curious question. And if we can get an answer to that, I think it would be good.
Yeah, put the rumors to rest, you know. Put the rumors to rest, yeah. All right.
Thank you so much, my dear. I appreciate it.
All right.
So yeah, I'll email the governor's office and see if we can get a definitive answer. They may not answer it though, but I've certainly heard it, but I can't swear for it. Let me put it that way. So it is interesting. Now, the other thing is, I've heard people say, well, if a person is not an elected, if they're not a minister, then that disenfranchises their constituency. Well, not everybody. Remember, there's 19 constituencies, folks, and not everyone is going to get a ministerial position. And I'm going to go out on a limb here and disagree and say that I don't think that you're automatically disenfranchised because your elected person isn't a minister. There's only how many ministers? 9, 10 ministers? 9? And so that's not even half. Or is that half? How many we got? Almost half, right? Listen, once they're qualified ministers, they're focused on whatever. They're doing the job for the entire Cayman Islands, not just for a particular district. So I don't think it disenfranchises you. In fact, I think that being stuck in that government building as a minister means that there's a lot of things that are happening at the constituency level that, quite frankly, you're going to be missing out on. So, I think that might be disenfranchising your voters more than you not being in the government building as a minister. And this is what I was saying last week, because some of you are like, oh, well, what about William Panton? William Panton is stepping back from being a minister, and he wants to actually focus on his constituency. So, I don't see the problem. Now, listen, if the good people of Bordentown West, and you guys, believe me, had information about Chris Saunders and who he is and his behavior, and it seems like for the majority of you, that did not sway your vote. You still put in a man who, has very questionable behavior when it comes to women, just like you did McKeeva Bush for over 40 years. So I hope to God it's not going to take 40 years to get rid of Chris Saunders. But you guys knew that. So if you were willing to vote him in on that basis, knowing that he has to, if he got a ministerial position, he would be around women. Why now is it an issue if the governor says, oh, I can't make that happen? Like they have to protect the civil servants. The voters wouldn't protect the female civil servants. So if the governor steps up and says, well, I'm going to protect them and not allow a government to be formed, even if it's like an unofficial position, what do y'all want me to say? There's nothing that I can say. So all I can tell you is I would support her decision, in fact, if that's what it is. And I don't think that you guys should be up in arms, because somebody even said, oh my God, Sandy, we're going to have to call a by-election. I was like, a by-election? But you guys voted him in, knowing full well the type of person that he is. So why would there be a by-election? On what basis? If you guys want womanizers, if you want women beaters, if you want, fornicators, if you want, people who have freak-offs and all this kind of stuff, you knew this stuff before the election. This wasn't something you didn't know about Chris Saunders. You knew it, and you still elected him to public office. So that's why when people say you get the government that you deserve, there you go. You get the government that you deserve. You get the representatives that you deserve, because you have full knowledge of who they are and what they are, and you're still putting them back in public office. So let him sit on the back bench and still fight for the people, which is what he should be doing. Hopefully he's showing up to swearing in day to day and represent the people with the best of his ability, minus the freak-offs. Leave that somewhere else, please. Maybe he's traveling to do another freak-off post-election because it was so much stress. So I don't know. But I'm just saying, at the end of the day, you've gotten the representative that you wanted, the majority of you. A lot of us didn't want him, and we still got him. And now we have to put up with him for another 4 years unless the good Lord steps in. Let me not put my goat mouth in anybody. Sandy, don't say anything else because your goat mouth is really raging. Don't do it. Okay. Let me just relax myself. Don't put my goat mouth in anybody. Don't put my goat mouth in anybody. Okay. All right. So that's all I can say about that. And again, I don't think it disenfranchises anyone because he's not a government minister. Okay. So somebody said, so I heard this rumor. I'm not sure if you want to say it on the radio, but I'd like you to tell me if it's true or not, that Mr. Panton wasn't given a ministerial position because there's an ongoing investigation with him and the UK office saying that he leaked the Saunders letter written by France Manderson to you. Is that even true? Well, I will certainly address it because I also heard that, and I heard it from none other than Joey Hugh. So Mr. Hugh sent out a voice note talking about why, the government had already been formed. I don't know how many of you heard this. And he says that, the reason why Wayne Panton wasn't part of the government is because there's a investigation about a leaked document or leaked documents or something. He didn't specify what it was. So I don't know definitively what it is, but it's from the sources that I've checked, it seems like if people had to surmise, it would be about that letter. So I can tell you with 100% swear on Bible, swear on all your children's lives and my child, that Wayne Panton was not the person who gave me that letter. It's the civil service after all. And things are not as cloak and dagger, nobody knows what's going on as you think. Okay? Multiple people would have had access to the termination letter. Sometimes letters are left on, or documents are left on, machines. They're electronically available, et cetera, et cetera. So don't jump to any conclusions about who I would have gotten it from. But I can tell you with 100% certainty, it was not Mr. Wayne Panton. That I can tell you. Where I got it from or who I got it from, how it was left in the windshield of the car, that will have to be left up to speculation. Now, I also don't know if the governor's investigating this because I did ask that question, and they said that they would get back to me. So I'm actually going to include that in my official questions. They said they'd get back to me, and I haven't heard anything yet since. So, okay. So let me just send that now. Let me just send it out. Is it true that Chris Saunders is not permitted to hold a ministerial position because of the reason he was previously terminated? Is there some investigation? And I have to wonder who would be investigating it, because that wasn't something that involved the governor's office. So why would the governor's office, in other words, it wasn't correspondence to or from the governor's office. It was between France Manderson and Wayne Panton. So it would either be the premier or cabinet office investigating it, or France Manderson investigating it. And I didn't get the sense that it was France Manderson. So I don't know who would be investigating it, and quite frankly, why. Hold on. But I do not think, and let me be clear what I'm about to say. If there is such an investigation, that would not have been a reason why Wayne Panton would not have been a minister. So that doesn't make any sense, because as you can appreciate, there are investigations all the time. Even McKeeva Bush, he was investigated and charged, and that couldn't stop him from being a minister. You know what I mean? So logically, it doesn't make any sense. So this is where I think Joey Hugh, especially when Joey will say, oh, he doesn't want people putting misinformation out there about him. When he puts misinformation out there about another elected member, I think that he should think carefully about how that affects their reputation in the community. Imagine if we started a rumor about Joey, let me not go there. let's just say we started a rumor about Joey. He wouldn't appreciate it. He would call and be like, hey, you know, that wasn't me and this and that and whatever. So I think that he should also be careful with these hearsay sort of situations, because when it's coming from another member of parliament, it lands differently, doesn't it? Are you not likely to believe him more than someone just saying it on the street? And that's why he has a greater responsibility to, you know, be cautious with his words. And he should know the implications of that. So I don't know if there's an investigation. I have heard the rumor. I don't know if there's an investigation, but I don't believe if there is an investigation that would be the reason why he didn't get a minister. I explained it on Friday. My opinion, multifold. Number one, Andre is the leader of the party. He's allowing them to take the lead. I think the situation would have been very, very differently if it was not a coalition government. If it was a government where you had all TCCP people in, you got enough to form the government, it probably would have been him and Andre at the very top positions. But they had to compromise with the deputy premier position and give it to a CINP member because it is truly a coalition government. And so there are only so many ministerial positions to go around. You know, God knows Michael Miles could not have not gotten a ministerial position. He probably wouldn't have helped to form the government, and that would have been a problem. So Wayne Panton is, in my opinion, humble enough to just fall back and say, I've been minister multiple times. I was premier for a couple of years in this country. You know, you guys go out there, put the government together. And if you have to do that by, you know, giving people position, because some of them are not going to do the right thing unless they're getting a little bit of a position, then it is what it is. And he didn't have to be in the mix for that to happen. So he is there and he's part of this coalition government. And should anything happen, for example, and someone needs to be terminated, right? Then that termination will mean that he could then step in and take up a ministerial position if it happens. So you've got to always have a little bit of extras if you're smart about it, just in case something happens to a particular minister or member. And by the way, I heard that, you know, Michael wanted education, but that was such a conflict of interest that they could not give him education because he owns a company that is registered as a TVET by education and gets scholarships and sponsorships from the government. So this is where these conflicts of interest now come into play. And I have to tell you, I firmly believe that if you take up a government ministerial position, you got to pick and choose your poison. You're either going to be a government minister and give up all interest in any companies that have government contracts, or give up the contracts. I don't think you should be a government minister and have government contracts. We can see with what's his name there? John, how that has caused a problem because his company has a contract with CIAA and Cayman Airways. I think it's Cayman Airways who actually pays a lot of his bills and stuff. I don't think that should happen. Just like, you know, now that Michael Miles is a minister, to be fair to everybody and set the same rules across the board, I don't think that Michael Miles's company should have a contract with government. I think they should relinquish the scholarships and the contracts, or he steps aside as a shareholder and director. So he should have no interest in the company, sell it to somebody else. And I don't mean your wife could be the one. No, it shouldn't be any connection to you whatsoever. And that's the position that I stand by when it comes to not commingling, you know, your business with government and that sort of thing. Jasara says, I'm so ashamed of some people, of some of our women in Cayman who protect these types of men. Speaking of protecting men, over the weekend, I published a letter that was sent in on the eve of the election about Leon Gold. Now, I couldn't publish it then because, unfortunately, when I got to reading it, it was technically election day because I was here up to midnight doing stuff. And just like you can't put up signage about candidates, like, you know, promoting candidates and whatever, you can't do the opposite of that. So I checked with the elections office. They said, no, you couldn't put that up. You know, I said, okay, no problem. So that's why it was published post-election, because we didn't want to influence the vote. I mean, he only got like 21 or 22 votes, so it doesn't look like there's much influence. But his lawyers reached out over the weekend. about, oh, you know, these anonymous people, whatever, we don't know who this is. And basically trying to threaten legal action. And I said, listen, and he hasn't had an opportunity to respond. I said, listen, he can have all the opportunities in the world to respond. In fact, Leon Gold, everybody can go tell Leon Gold right now, Leon, you want to come on this program and address every single woman? Because I've gotten, when I tell you multiple, no joke, even another candidate, I don't want to say too much, who ran in the election, her daughter was almost a victim of Leon. So there's tons of stories about Leon. This isn't an isolated situation. This isn't one person who has a grudge with Leon. It seems to me that Leon has some things in his history that he needs to answer to. And it's not a one-off situation. So I replied to his lawyer. I said, listen, if Leon wants to issue a statement, I'm happy for him to respond to all of the allegations, not just this one, but I'll bring all of them on the table, all the different scenarios that people have described with him, and he can address every single one. He denies it, no problem. But I'm happy for him to come on this program and talk about it. Come on, Leon, sit down and do an interview. Anytime, any day, you just let me know when and where, and we can accommodate you. Do I believe these women? My personal opinion, when you have that many diverging women from all walks of life saying more or less the same thing about this guy, he loves to put his fingers in people's vaginas unsolicited. Normally when they're intoxicated is when they're being taken advantage of. Too many different women in different scenarios have said the same thing for me to not think that there's something going on here. I'm just being straight. Now, Leon is a public figure, right? So just like any public figure anywhere in the world, there are women who will come forward and say, you know what, I've never spoken up before, but I want to warn people, I don't want this guy to become a minister. I don't want him to become a Chris Saunders, because once you get in there, it's hard to vote you out. I don't want that to happen. I want women to be aware of who he is and what he is before he's even elected to public office. I don't want him to become a McKeeva Bush. And, you know, there's nothing wrong with warning people if these women have had these experiences and they come forward. So come on, Leon. You're free to come on and answer any of the questions. I don't know Leon. Supposedly he's a cousin, Lord Jesus. But I don't care. You could be my brother. And if these things were happening and being said about you, I think you have a responsibility now as a public figure to come forward and address them. Just like President Trump. Look at how many women have come forward about him. Now, the one thing that I'm concerned about in our community are the people who say, oh, this happened in 2014. This is now 2025. Why are we talking about this? Sit down and please educate yourselves and talk to rape victims, sexual assault victims. It is the most difficult thing that has ever happened to them in their lives. And for them to talk about it at all is a miracle. Even 10, 15, 20, 30, 40, 50 years later. We saw Brooke Shields. She was molested as a teenager, right? It's only now, 35 years later, 40 years later, that she's even talking about it after she's had children, female children of her own. She's able now, and lots of therapy, she's at the stage where publicly she can admit that she was a victim. Most victims never get there. And so don't think that a victim isn't being honest just because she's never spoke about it or she's never come forward. Things have changed in this country. You tell me, back in 2014, where would she have gone to bring this up? Ma Road wasn't anywhere around. So who would she have talked to about this? The Compass? Cayman News Service? What talk show? She would have called in Crosstalk with all men and talked about this? Come on now. I'll admit that I think what we have done, at least on this platform, is made it more comfortable. We are allies with women on this front. What I mean by that is women who've been victims. I'm here to support them. I'm not here to judge them. I'm not here to say, why were you drinking? As another woman commenting about, oh, why don't these women stop drinking and how they dress and whatever. I'm like, what? And that is why they don't come forward, because they're still subjected to that type of thinking and that type of questioning and that type of mentality. We live in a world where women should be able to walk around completely naked and be safe from groping her by the pussy, from sticking your fingers inside of her, and all this kind of stuff. But we don't live in that world. And that's a sad indictment, yeah? But how a woman dresses, how she carries herself, should not be a factor in whether or not a man chooses to sexually assault her. And here's the thing. Men don't care what you're wearing. When they want to sexually assault you, they'll sexually assault you. You could be wearing the burqa, covered from head to toe, not an ounce of skin showing, barely your eyes, and you don't think that those women are sexually assaulted and raped as well? Come on now. That's just stupidity to talk about, oh, how she was dressed enticed him. A rapist doesn't need any enticement. He's a sick mother, you know what? And he's going to rape you no matter what. Of course, don't put yourself in a compromising position. Don't go home, if you're intoxicated. Well, you're not going to be thinking straight, but your girlfriend should never allow an intoxicated friend to be escorted home by a man. Right? You take her home. Because why do you think he's always offering a ride? He's always your knight in shining armor. Like, oh, I'll be the one to give you a ride. Yeah, because he's looking at a ride for himself. And it's not the kind of ride that once you're intoxicated that you can even consent to. So it's a problem. Generally speaking, it's a problem. All right. Justice will be served. Yeah, child. I got to watch that goat mouth because y'all don't know how strong that is. Anne says, thank you, Jim. Many like yourself chose Cayman as your new home and have enjoyed living with us. But yes, sadly, the disrespect from others is the attitude that upsets us. And yes, CMR is our voice. Cayman remains beautiful. I didn't see Jim's comment, actually. Sorry, Jim. So many comments come in. Good morning, Jamie says, same happens when MPs, when they become Speaker of the House, their constituency loses representation. Well, in that case, you lose representation in the House because the Speaker doesn't have a voice to speak on issues because they're moderating. That's why the Speaker, in my opinion, should always come from outside of the House. So that, I think that comment, Jamie, is accurate. However, that does not mean that in their constituencies, they're not allowed to do things, right? I think in their constituencies, there's still a lot that they can do. So Paul the Man says the governor stays out of the civil servants and elected members matters. They can't stop anyone from being a minister. Well, technically in the Constitution, when it comes to the civil service, the governor is actually the head of the civil service. And the governor has delegated that to the deputy governor, which is Franz Manderson. But remember, in the Constitution, it says the governor is the head of the civil service. So if someone is harassing your civil servants, and that is something that has been accepted by the head of the civil service as a fact, then I don't see, what the issue is. Now, let me go back to the termination letter because the government, Franz Manderson's office, cabinet office, and the governor's office all claim that they did not, two of them, cabinet office and the deputy governor's office, refused to provide me with the letter saying different things. The governor's office claims that they don't have anything to give me. I find that very suspicious. But nonetheless, I am appealing all of those decisions to the ombudsman's office because I want, and trust me, I'm not a person who tends to request things via FOI very often. But when I do, and I see the fact that I don't get it because, his privacy might be jeopardized. I'm like, really? That is not a valid excuse. No way, shape, or form. So I want the ombudsman's office to rule on it. So I will be sending, I think they've come back because there's a process of where you first have to appeal it within the department and then it goes up to the ombudsman's office. I'm going to go back to the ombudsman's office and I'm going to ask them to please make a ruling on this because I want to see what their ruling says in relation to this. As an elected member, you're not entitled when it comes to bad behavior. You're not entitled to privacy relating to the allegations. And as you can see, there was nothing in that letter that would have impacted his privacy. In fact, the letter didn't even name him. It does name him by position, but it doesn't even name him by name. So what in there is private to him? The fact that women were accusing him of sexually assaulting him, of sexual harassment, that's not a privacy matter. So, Donald says, respect to Mr. Dexter as always. However, please make sure the facts are straight when stating Caymanians wouldn't want to do certain jobs. For one, government/workforce provides scholarships for Caymanians or paper Caymanians who are interested in taking professional geriatric care training exams. Yet after months of doing so and graduating, Cineco themselves are still dragging Caymanians through the mud by hindering Caymanians from being hired. What a effing shame, disgrace throughout our, and unfortunately got cut off. Whoops, what a mess. I tell you what. Mary, good morning. Says, according to the RCIPS 2021 report, 56 of the 90 reported sexual offenses involved a youth. The youth marker includes a young person as both the victim and or offender. Wow. Mary, that's shocking and sad. Mary goes on and says, in 2021, where an offense location could be confirmed, 47% were related to a residential location, while 8% were linked to an educational facility. Wow. Oh my God. And mentioning that April was Sexual Harassment Month. Was it? I didn't even know that. Thank you for telling me that. I mean, I try to talk about it all the time, but I did not know that April was Sexual Harassment Month. Sexual Assault Awareness Month. My apologies. Good to know. And isn't it so interesting that our government, they celebrate all sorts of different months, but I've never heard them celebrating that one. And I have certainly never seen the minister responsible for gender affairs issue anything in relation to it. Wow. Quite interesting indeed. Siobhan Berry says, exactly, need to stop the victim blaming, hate that shit. Jasara says, I can imagine how hard it is to even speak about these things. Sometimes we have to try to put ourselves in other people's shoes. Absolutely. Gabby says the fact that 20 people still voted for him speaks volumes. Well, he wasn't convicted of rape, to be clear, so let's not call him a rapist. But yes, the fact that 20 people, even with those allegations, would still vote for him is very, very interesting indeed. K-Man says, wait, was he doing this while he was with the current wife? Well, even he was with the current wife, even when his court case went to court. And he was basically accused of doing the exact same thing, putting his hands inside of a woman. He was charged with digital penetration. The jurors let him off. All right. Jasara says Ralston is the best person for education. We sure hope that he get in there and fix it now, because it's a mess. Jasara says Mr. Panton is humble in doing what he has to do. All right. Island Pearl says PPM is just bitter because they're on the back bench and they can't spend our money as they please. Yeah. I agree. Paul says, I think he didn't take a ministry because he'd rather form the government quick and make the others happy. I totally agree with that. Ellard says, does the rumor of the BT West MP not being able to become a minister have anything to do with the previous Governor Roper having police evidence of international criminal syndicate financially funding or controlling a certain politician? Doesn't the governor still have responsibility over police and the chair of the National Security Council where he could have this information? So to be clear, though, the governor didn't speak to any individual person. What he said was the police commissioner at the time, which was Mr. What was his name again? Burns, indicated to him that there was a very strong possibility that this is why the elected arm of government was not minded to actually do anything about it, because quite frankly, some of the politicians themselves might be receiving financing, campaign financing from the very same said individuals. In other words, big time gamblers have a lot of money. Are they providing funding for some of these MPs? Who knows? Or candidates in general. Oh, Lord have mercy. Oh, I'm so sorry. I got to go to a meeting this morning, so I'm keeping an eye on time. So that's entirely possible. All right, one more thing quickly. This story we did on Michael Miles yesterday kind of got him, I guess, up in a little tizzy. And he responded to it by saying that our headline was misleading. I always say to you guys, please don't read just the headlines. There are some restrictions on what the headlines can say, like so many characters and whatever. What I would suggest is that you actually read the article, because in the article, we quoted exactly what he was saying. And if you took it out of context, that meant that you just simply needed to read more. So this is what he said.
We've looked at the majority of our manifestos, I think, have a lot of synergies, and we want to make sure that those synergies are included in the coalition agreement. Nothing should be, I'm a proponent of being against hidden agendas. I've made it very clear to the 11 other or the 10 other people that have been elected and that has formed the government with me. I am not running for the next election. This is the election I've been elected in, and I intend to make sure that we are serving the people with integrity and transparency. Therefore, all cards are going to be on the table for all of us, or this is never going to work.
All right, so that's the context in which he is saying I'm not running for the next election. What he was trying to say, and I think the way that he said it is what was problematic. So if people are misunderstanding it, don't blame us. You said you're not running for the next election. That's actually a very accurate statement. But what he was meaning to say, because that's the context of it, he was saying how they formed, they looked at their manifestos, they had a lot of synergies, and he's not running for the next election, meaning that in this time and place, he's not thinking about the next election. He's trying to focus on the next 4 years and I guess doing the best job that he possibly can. It could have been explained differently. It could have been said differently, right? I think a lot of people got it. They understood what he said, but equally, there were people who didn't get it, who didn't understand what he was saying. They actually thought he meant that he's not going to run in the next election. So don't come at us about our headline. In the story, we quoted exactly what you said. We've shared this, and even some people watching this still did not get that what he actually meant. That's not my problem. I said, you know what? Let me put the video up there and see how many people are crystal clear. Some were crystal clear and some were not. So what I would suggest is improve upon the communication or do a little bit of a better job further explaining what you meant by what you said. Okay? That's all I'm going to say. Damien says not everyone has the same IQ. Sometimes that is why you explain things at the lowest possible level so that everybody there and above can get it and can understand. All right, moving on. I don't want to belabor the point and waste too much energy on that because it really isn't worth it. Today's swearing-in day. If you live in the beautiful district of West Bay, some of the members, the West Bay Quattro, they're offering a ride. If you need one, you can reach out. They're going to be picking people up at 1 o'clock. Somebody says, I still don't get it. Never mind, honey child. Today, swearing in day ceremony starts at 2. 1 o'clock, you can, go to the Ed Bush Stadium parking lot. They'll pick you up. They're going to return you at 6:30. I'm wondering why so late. What did I miss? Why 6:30? But anyway, I don't know. Is there food afterwards? I can't remember there being any after the last one. But anyway, maybe this one's going to be a bit different. I'm not quite sure. But, I think I had the time wrong on my posting. I think I said 6 p.m. Let me change that. So anyway, they say that they're going to return you at 6:30. Yes, I put 6 o'clock. That's what I thought. Let me just fix that. So if you need a ride, or if you don't want to drive all the way to town, because parking, of course, no doubt will be very, very tight. Feel free to take them up on this offer. Just be there promptly for 1 o'clock, and they'll make sure that you get back home no later than 6:30. Well, at least at the Ed Bush Field. All right. So coming out today, swearing in ceremony. It's going to be a very, very big day. And this is the day that we're all very, very excited about it. El Rey says headlines are designed / written to get the most clicks / likes. Not always. Sometimes they're just trying to convey what the gist of something was. He's saying he's not running for the next election. He's focusing on the 4 years now. So I don't know. Kutet. Is that how that is pronounced? Kute? It says it's good that you include all the details in the article, but you obviously craft your headlines intentionally to get the maximum amount of interactions and engagements on social. Believe it or not, most of the headlines are just written by someone who, like, okay, let me just pick this headline. They don't put that kind of thought into it. Trust and believe me. It starts at 2 p.m. Yes, the swearing in starts at 2 p.m. We will have it live here online, and I may go to it in person, but you guys know I'm not really crazy about crowds, so I don't know yet. We'll see. Maybe not. I'll let you guys know. So, but either way, we will definitely be live streaming it. Yes, 2 p.m. We will have it here. And as a matter of fact, I'm going to go schedule it now. Okay, I've got something to do. Traffic advisory. Obviously, because of the swearing in, there will be some places closed today. So please be mindful of that. And yeah. All right. Yep, that's it. All right, folks. See you mañana. Jim says, Sandy, make sure you wear your Kentucky Derby hat today. I don't have very many hats. I need some fascinators. I'm not a big hat person, but I need a fascinator or two. So if I go, I will probably not even, I need to do something with my hair. I need to go get it blow dried or something too, because it's looking a little rough around the edges. But I am not so sure that, I don't think I had 1 or 2 fascinators, but I don't know what they go with anymore. And then I got to dress up and I got to put on shoes that are probably going to hurt my feet. And we'll see how I feel. All right, folks. First, I got to go meet with my lawyer. My big KC's on island. Honey chow. Big shout out to all the good lawyers out there. We love you, love you, love you lots. You guys did an amazing job for your clients. The ones that do and the ones that don't should be disbarred. On that note, you guys have a fantastic day. I'll see you later on, 2 o'clock. All right. Bye-bye for now.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.